Hi, good morning, everybody. So we are going to start with this room in the buffalo and camelids area. So it's my pleasure to introduce to Dr. Thomas Wittek. He's graduated from Leipzig University in 1994. He made the thesis and the doctoral habilitation in that place. He's specialized in ruminants and South African camelids, work as a clinic and research in Germany, US, and Scotland. Currently, he is a professor for ruminal medicine and surgery at BovATUS in Vienna, Austria. Worked with South African camelids for over 25 years. Please join me to welcome to Thomas Wittek.
Thank you very much for the introduction, introducing me. Thank you for coming along. I didn't expect a big crowd, so I'm quite happy having you here and trying to just share my passion for these wonderful animals with you. And you may ask you, why is this a part of the Congress which deals mainly with cattle? I think it is a good point and a good chance for us cattle veterinarians to kind of increase our work field, our experience quite easily. And I'm going to tell you why I think we are the best to do this and to work with these animals. This is what I like to go through with you in these about 45 minutes, and we will have hopefully a short discussion afterwards. So first, as I expect that not all of you are already working with South American camelids, I'm going to do a short introduction, and then, of course, I'm going to talk with you about why I think a cattle veterinarian should know something about those animals, and trying to tell you what's happening at the moment. What we see, of course, I have to confess I have a little bit more European point of view. I've been to Peru, but I'm more, of course, I'm working in Europe, so my point of view is, of course, a little bit biased to Europe, what's going on there. And then I try to share you some of the recent research, some of a group in Germany and a little bit of research we are doing in Vienna and Austria. Talking about Austria, you may have looked in the program, there's an Australian flag. So we don't have kangaroos. We have mountains, but we don't have kangaroos. I'm coming from Austria, not from Australia. All right. This is not as important. So if we're talking about llamas and alpacas, we are talking about camels. And camels, there are two main groups. There are the so-called Old World camels or Old World camelids, which, as the name is suggesting, live in the Old World, means live in Asia. So these are the dromedaries and the Bactrian camel, the one-humped and the two-humped camel, and these are domestic animals. There are no wild species of the Old World camelids. This is completely different for the New World camelids or South American camelids. There we have two species which had been domesticated. These are the llamas and alpacas, and this is what we're mainly talking about today. And then we have two wild, non-domesticated, still living mainly in Peru. I show you some pictures afterwards. This is the guanacos and the vicuñas. There are kind of different opinions about the evolution happened, but what we are pretty sure about, that they originally lived in North America and in Mexico, what is now Mexico and the US. And then for unknown reasons, a part of the population moved towards Asia, overland at that time, and the other part moved to South America, and the remaining population in North America died out, so we don't have these animals here any longer. And there was a long belief that the guanaco has been used for domestication, and till some genetic analysis showed that the vicuña was included as well. And this resulted in a change of name. The alpaca formerly was named as Lama pacus, and now it's called Vicuña pacus. So it has a change of name. A couple of pictures illustrating a little bit. These are the vicuñas. They're mainly living in Peru, partially in Chile. These are wild animals. There's still a good number. And on this picture, they look a little bit larger, a little bit taller than they actually are. They have about 45 kilograms body weight. The males, the females even lighter, and the body height, the height of withers are not above 50 centimeters. The other species, other wild species, are the guanacos. There's a larger number still there, and these are, you can tell from the grass, from the rich grass there. These are pictures taken in Europe. They are mainly kept in zoos in Europe, some private owners as well. And you can tell that this is a guanaco by the typical fleece colors. All the dorsal parts are dark, mainly brown. The ventral parts are more or less white or beige. And then they have these typical banana-shaped ears. And the head is typically a little bit darker, so it is not easy to tell them apart from llamas or from other species. Coming to the domesticated, we have the llamas here. There are two types. They are not breeds. They are called types. This is the classic type, and there's a so-called woolly llama, which is not as common, and there's maybe a third type, which I don't have a picture on here, as they are rather rare. These are so-called Suri llamas. What a Suri is, we talk about in a second. So you can, the llamas, their body weight varies between, let's say, 90 and 150. Some of the mighty males, they may have even close to 200 kilograms, so they can be quite heavy. And they are taller than the alpacas, and again, you see these banana-shaped ears. Yeah? You see, this is quite a typical sign for a llama. And additionally, the fleece, the wool, the head is almost without wool, and also the distal limbs, they don't have much wool there. And this is a difference to the alpacas. This is we have two alpaca breeds. This is the Uakaya alpaca. The difference between the two breeds, and you will see it in a minute, is mainly the characteristics of the fiber. The Uakaya fiber is a kind of zigzag pattern, and this is the typical one. Uakayas are about 95% of the whole population, so, and the remaining 5% are the Suri. And you can see that the character of the fiber is completely different. This is kind of a curly type of the fiber, and as you can see, they come in different colors. Originally in Peru, they were just breeding the white as for technical reasons, as the white fiber could be dyed in any other color. So this is just was just a technical reason, as it was at that time difficult for them to dye a brown or a black fiber into, let's say, green or black or blue or whatever. But the consequence is that the white alpacas still have the higher quality of fiber in the population. So this is breeding for century. And another remark before we go on, from historical research, we know that before the Spaniards came to Americas, the breeding of alpacas was about on the same level, the wool quality, as we have now. So it was a huge setback for the breeding, for the quality of the animals after the Spaniards came to the Americas. All right, what they're good for. We find them in larger herds, and they're really huge herds, especially in Peru, thousands of animals. The there are huge herds in the US, Australia, a little bit smaller, but still large herds in some countries of Europe. But on the other side, we see, and this is quite an increasing number of animals as pets. We see them in very small herds. We have people just in Vienna. Vienna is a 2 million inhabitant city, so it's not as big as Mexico City, but this is a substantial town. We have owners keeping 3 alpacas in their backyard garden, just as pets to impress their neighbors, whatever reason they have. And so this is something we as veterinarians need to consider. We need to consider. I'll come to this also a little bit later. They are breeding, or the breeders' organizations, they organize the breeding. There are herd books, and there are kind of tests for breeding, depending on the legislation of these breeding associations, and there are shows. And these shows are rather important for the breeders who want to sell animals, high-quality animals. There are national and international shows. Next year, the World Alpaca Congress will be held in Germany, and so there is a lot of things going on. The second point, why do I think a cattle veterinarian should know something about alpacas? It could be just a very trivial reason. I'm the head of a ruminant clinic, a university ruminant clinic. And of course, we have to treat for teaching sheep and goats and cattle. And we don't make any money with them. But the alpacas and llamas, they keep us financially alive. Saying this, these animals are typically rather valuable. And many owners are prepared to spend larger amount of money. And this is, of course, good for an income. But coming to the more, let's say, professional reasons why I think this, treating ruminating animals. The South American camels are ruminating, although they are not ruminants. No, it's just taxonomy. So we have an idea how a rumen is working. A small animal practitioner has no clue about this. They do strange things, I can tell you. Even worse, horse practitioners. So therefore, I think we are most qualified. But on the other hand, these are camels. So meaning there are some differences, and llamas and alpacas are neither small cows or large sheep. They are just camels. So there are some specific things, but they can be learned and they can be trained. And of course, we, as I already mentioned, we have large commercial herds on one side, and we have pet owners on the other side. And the ideas about treatment can be very different. It can be very different, and we need to keep this in mind. These are the most important points of the traditional use, mainly in South America, but also in the professional herds. This wool, meat, transportation, especially llamas were used for this and are still used, and of course animals for sale, so breeding animals for sales. In Europe, North America, Australia, New Zealand, slaughtering the animals doesn't play any important role, although at least in Europe they are considered as food-producing animals by the legislation. So this is something which is possible, but it has no importance at the moment. Animals for sale and wool, of course, this is of importance. But we see a movement to new ways of using these animals. And this is tourism. I'm going to talk a little bit about this. A big development in animal-assisted therapy. So just using the llamas and alpacas for therapy of people with dementia, autistic people, people with aberrant behavior, young people, all different kinds. This is a huge development we see at the moment. Or other human-animal interaction, entertainment, sport. I go a little bit into detail, sometimes quite funny. And then some use them as protection against predators. It's mainly bird of prey. They put 2 or 3 llamas in their chicken stock, and they should keep away the hawks or buzzards or whatever is flying around and trying to catch the chickens. All right, just illustrate what happened in Europe, and this has happened in the US before, 10 years earlier, and it may happen in other areas. I suppose it may happen in other areas. We had, till the 90s of the last century, we had a very low number of llamas and alpacas and some guanacos, and they were mainly kept in zoos. And then it started that private owners bought and developed breeding programs, started breeding, and meanwhile, we don't have good numbers. We don't know exactly how many animals are around. We have just estimations, but for Austria, we are just 8 million people country, so we are a small country. We think that we have about 25,000 alpacas there. So it was a big increase, and this is data for Germany, from Henry Wagner. But we don't know exactly how many we do have. This is just a recent questionnaire we did, and we were asking for what the owners, the animals, are using. And you can still see production of wool, which is, of course, one of the main reasons to keep them, is very important, especially for the alpacas owners. But the next mentioning was already walking tours. So they offer walkings, and this is a big demand to people like to go on the farms and walk with the animals. And this could be just from a 1-hour tour to tours offered over several days, going into the Alps, staying overnight in huts, and having mainly the llamas there. So a wide variation. Landscape conservation, breeding, but hobby, then events and therapy. I already mentioned this is something which developed rapidly, and this is something where the animal-human interaction becomes more and more important. And this has, of course, some implication. This is meaning we have to look, are there any zoonotic diseases which can be transferred from the animals to the human, especially if you think if the animals are used for therapy, these are often vulnerable people, not healthy. So this is something we need to consider in the future. On the other way around, is the use of these animals always justified how we are doing this from the animal welfare perspective? So is it fair to them just to have them walk, let's say, 3 times a day, 2 hours, or is this against animal welfare? We don't know it at the moment, but we need to work on it, I think. And there are plenty of more ideas using them. I have some favorites. My favorite is the blind dating with alpacas. You can just check them out on the internet, or alpaca yoga is always very good idea. So it's not the alpacas doing the yoga or the people, but and of course moonlight walks sounds interesting, or river walks. I mean, yeah, and there are plenty of more fancy ideas, just business ideas, and this is something we need to talk. Yeah. Coming to research topics. These are the traditional research topics before all these changes in the position of the animals in the society started. These are male and female reproduction. The research has been mainly done in the 80s, 90s, into the 2000s, mainly in Peru, partially in the US. And there's, of course, fiber quality and quantity studies, mainly in Peru, but also in Australia. You know, they are very strong and cheap wool production, so they also took this knowledge and transferred it to alpacas. Metabolism and nutrition, North America, mainly people like Chris Zebra, Robert von Sauen, you may have heard of them. They're also working in cattle. Immunology, you may know, South American camelids, they have specific types of antibodies which are interesting for people trying to use them for therapy, mainly for cancer or immune therapy. There's a lot of research. And then, of course, a general topic, endo and ectoparasites, which is a topic all over the world. But as a consequence of the new ways using these animals, some new fields of research has been developed recently. And this is, as already mentioned, animal welfare, herd health management. We are not really good at this. We don't, to be honest, we don't have an idea how to do herd health work in llama and alpaca work. It's never really nobody actually did research on these topics, and some other things I have already mentioned. I'm going to show you some examples. But in general, there's, in the last 2 decades, there's a development towards more research in New World camelids and South American camelids. I looked up in the 70s of the last century, there were peer-reviewed, just a handful, 10 to 20 per year. And now, last year, we have over 250 publications in scientific papers. So there is a development, of course, if you compare, let's say, to cattle or small animals, it's still a niche. This is just a small number of people, a small number of groups working on llamas and alpacas. In the second part of the presentations, I'd like to show you a couple of recent research projects, introduce you a little bit. There are actually 3 examples. I'll start with the first one. And this is one of a colleague who's working with llamas and alpacas for at least 15 to 20 years now. Henrik Wagner comes from the University in Gießen in Germany. And he and his group got a project funded by the German government about a herd health management, study on a herd health management concept, which would be suitable for South American camelid farms. And as mentioned, it's the university, but they have a cooperation with a major breeder association in Germany, and is supported by the government as the number of animals is increasing quite substantially. And they look on animal welfare, animal protection, herd health status, herd health management, and also the efficacy of antimicrobial and anti-parasitic drugs. But another and very important part of the project is education of the animal owners, veterinarians, especially the older colleagues. They haven't heard anything during their undergraduate studies about South American camelids. We started in Vienna around the 2000s, and some of the German universities started in 2000, but there are a lot of European universities haven't started or have just very basic teaching about this. So this is quite important, and it's also important to talk to the official veterinarians. They often don't have any ideas about legislation, and they do sometimes very strange things, just for the reason is lack of knowledge. We had, or this group had a questionnaire asking what the veterinarians who are working with South American camelids actually doing. And as you can see, the majority of the work is into treating individual animals. And if you look further down, only 32% of the veterinarians who answered the questionnaire were saying, yes, we do some work in herd health management. This is just 1/3, so it is not a big number then. And this is just the scheme the group of Henrik Wagner worked as, that they tried to develop a system where the veterinarians, the animal owners, but also the official veterinarians have a role in this herd health management and trying to improve the herd health, trying to control the herd health. Going to show this. This is what they developed. They used 5 piles. This is prophylaxis, herd health status, so kind of supervising the herd health status, biosecurity, which is a big point, the use of animals, so use of animals, for instance, for tracking or for other activities, and then husbandry and feeding. And what they tried to do at the moment is to develop checklists for the veterinarians, but also checklists for the animal owners, where they which can be used to have a more structured approach to herd health. And what we often see is that the owners submit animals, sick animals, to us in the clinic, which are chronically ill for weeks, sometimes maybe months, and nobody has realized that these animals are ill. You know, they have big fleas and they look quite cuddly, very nice, and if you palpate them, there's almost no muscles left. They're completely emaciated, and this happens, and this is not rare. This is just the time of the year. They shear end of May and June, and after shearing, they suddenly realized, they realized suddenly that the animals lost weight, and they come, this just suddenly lost weight, and telling them, look at me, I'm trying to lose weight for weeks and I'm not successful. It is not just suddenly loss of weight. It has been happened over months and weeks, but nobody had realized it, and some of these animals actually die. And so another example, just to showing you, looking at this poor llama, you see this extension of the front limbs. This animal was still used for daily walks, and nobody was taking care. And I think this is we as veterinarians have to look at this. Yeah? You can't use, it might be even indicated to euthanize this animal, but certainly it can't be used for any walking tours, yeah? Just walking like this. So this is something I think we need to consider and talk to the owners, and of course we need, if we see such animals and they are using for breeding, we need to talk to the owners. Don't use this. Don't use this. It is a problem what we are facing at the moment. Another very important point in herd health management is biosecurity. And as I already said, we have a number of farms trying to sell young stock, trying to sell breeding animals. And of course, they have to go to shows, they have agriculture fairs, they have open farm days, and often there are no regulations, no biosecurity regulations at all. Everybody who wants can go into the farm, can touch the animals, and no regulation at all. There are also the reproduction management. We don't talk today about reproduction, but it is kind of makes it difficult for the owners, as artificial insemination is not working. It's not working for biological reasons mainly, but also for technical reasons. And embryo transfer, this has been introduced, but it is not allowed by a number of breeders' associations for different reasons. So it is normally natural mating, and so there's a huge transport of animals into different farms. We call it breeding tourism, and so this, of course, this is from the biosecurity point of view a disaster. And so females are moved to other farms, but it's even worse with males. They are just driven around through the country and stop at that farm, then they're going to the next farm, going to the next farm, And this is what the situation actually is. I know one breeder quite far from the east, and he wanted to have his female mated with a stallion which is in the west, and what they did, they just both put them on the trailer, met on the motorway on a parking lot, and then they went home. So it is sometimes really strange what happens there, but it is risky. And also stress, we know that the animals are quite susceptible to ulcers, to C3 ulcers, what is the equivalent to abomasal ulcers. And stress is a point which needs to be considered in this. All right, just to summarize these research, what the group in Germany doing is that they trying to increase the cooperation between the farmers, veterinarians, and the official veterinarians, and they trying to develop recommendations how such work could be organized, and thinking that a written consent would be very, very good. And coming to a second example, it's Bianca Lambacher mainly did this. She's a member of our group in Vienna. And this is about stress response of alpacas on different restrainment and shearing methods. There was a huge debate in Germany and in Austria, even some people saying we shouldn't shear the animals any longer. This is cruel to them. Of course, this is not possible. It would be even more complicated animal welfare-wise if you don't shear them. And the legislation is saying that they need to be shorn at least once a year. This is valid for alpacas. For llamas, you can wait another year, so this can be done every second year. And there are different methods how to restrain and to shear the animals. Is either standing or on the ground using a mattress, or sometimes not. And it's a tilt table. I'll show you a couple of pictures. And there are, of course, public concerns about welfare. You may check the internet. It's full of remarks on this. It's full of different opinions on that. Just a couple of pictures. In a standing position, so the animals, positive animals in normal position, the legs are free. This is always good for a prey animal that they, if needed, can jump away. The negative points, it might be that it might take longer. The animals, that's what they often do, they just drop suddenly and may injure themselves, so a higher injury risk. This is an animal on the ground, on a mattress, and as you can see, the front and hind limbs are rather fixed and extended, so this might not be a very comfortable position to the animals, but a positive thing, it might be that it's a lower injury risk as the animal can't move. And then the tilt table, which is also, the animal is also fixed to the table, but the movements are much slower, of course, and it's good for the shearers. He or she doesn't need to bend down. It's good for the back of the shearer. So the research question was which shearing methods resulting in the highest stress response, and are there any differences, and which part of the stress response is already provoked by the fixation of the animal, by restraining the animal, and which part is just the shearing. So we had two parts. Part one, restrained but not shorn. Part two, restrained and shorn, 15 animals. And we had a number of parameters, clinical parameters, the cortisol as a measurement for stress, animal behavior. I'm not going to talk about this too much as a lack of time, and duration of the procedure and injuries. So just to go through, this is the part one, so the animals are not shorn but restrained, and this is just showing you the three methods, the respiratory rate, and what we found there are some fluctuations, but there are no statistical differences in this, and the respiratory rate, the heart rate, and also the body temperature remained in the physiological range. So nothing about this. But looking at the saliva cortisol, it increased quite substantially, but it increased in all methods. Just restraining the animals causes a cortisol peak. But what you also can see, there are huge individual variations, wide individual variations in the cortisol level. And the same is true for the fecal cortisol metabolites, which are measured 3 hours after the manipulations. It is the same. There is an increase in all methods, but a wide variation between the animals. Looking at the part 2, now restraining and shearing, and we had no differences between the durations, and the standing position was numerically the shortest. So contrary to the ideas we had before, but we had, all injuries were minor, but we had the highest number of injuries, normally small cuts, during the standing positions. Again, now the heart rate and the same situations, no statistical differences between the methods and no increase. We couldn't see any effect on this. Again, saliva cortisol, and you see the same pattern as we have seen, just restraining the animals without shearing, and the concentration was not higher in comparison to the part 1, so not shearing the animals. So it seems that the shearing itself doesn't do any additive, has not any additive effect, at least talking about the cortisol concentration. Again here, same situation, wide variability, but increase in all 3 methods. Talking about behavior, it was rather difficult to compare, as you can't show behavioral variations if you're fixed on the ground. Yeah? You can't try to run away as your legs are fixed. So it was a little bit different to compare, but the lowest influence has been seen in standing animals. So the recommendations were that the stress response was lowest in the standing animals, and the time was shortest, at least numerically. We did recommend that the standing position might be the best for all animals who tolerating this, as we had one animal which we couldn't restrain, holding with 2 people, and for this animal it's then better to use a different restraining method to avoid major injuries to people or to the animal. So, and the final example is a study which was done in Germany. Louise Kulcher, she was a doctoral student in our group, and she did a study on efficacy of anthelmintic drugs in German alpaca farms, which is, as people working with beef cattle or working with sheep and know that this is a major problem if animals are on pasture. So there is a perception among the owners, but also veterinarians, that the drugs don't work properly. But this has to be critically seen, as especially if the owners, they do not understand that these drugs do not have any long effect. They're just effective a short duration after they have been administered, and then the effect is gone. And most of the suspected inefficiency is most likely reinfection. And therefore we tried to look in this. We used the fecal egg count reduction tests. Just very briefly, most of you may know this. This is just counting the number of eggs per gram of feces before treatment and after treatment in a group of animals, and then do some calculations, some math. Fecal egg count reduction, it means it is a sufficient efficiency, a sufficient treatment success if there is a decrease by 95%, which is for moxidectine and monopantail, and 90% for fenbendazole. We had a number of farms, alpaca farms with 20 animals, and we had 34 herds which voluntarily took part in the study. We had 617 samples from them, and which we used. We had to have an egg count above 150 eggs per gram feces. This is necessary to do a reduction test. If there are no eggs shedded, you can't do a reduction test. And then we had these 3 drugs. These drugs had been chosen as these drugs were used by the farms. Yeah? So we used, on the medical history, we asked the farmers, what drug are you using for deworming? And we used exactly this drug to show if it's efficient or if it's not. And I have to mention that the dosage of cytidectine and so moxidectine and fenbendazole, cytidectine and panagur, has just taken from goats and sheep. There's no study behind, so we don't know if this is the appropriate dose. There is a study on monopantail, and this is the people working with sheep know that is in sheep 2.5 milligram per kilogram, so this is the 3 times dosage which is required in alpacas. So this is just what we got. Lots of Eimeria, which is expected, strongolids, nematodes, some cestodes, and treasuris. That's what we expected. And out of these 617 samples, we had 215 samples with egg count above 150, so we could use those samples for further analysis. And what we realized is that in comparison to sheep and goat, the number of eggs per gram is rather low. And even if they were kept together with sheep and goat, there was a lower number. All right, just coming to the results. This is just before treatment. You see the 3 drugs, fenbendazole, moxidectine, and monopantail. You can already see a wide variability again here, the effect of the different effect of the drugs. And if we are looking at the farms, this is on a farm level, these red lines are the 95 or 90%, and you see fenbendazole, the majority of farms were below. Some farms here in the moxidectine also, and even in the monopantail, were below. But in general, the reduction rate was sufficient here, was insufficient in the fenbendazole. Looking at the species of gastrointestinal strongylides, it seems that there is a difference between them. So it seems that Hemoncus and Cuperia, also Trichostrongylis, has more resistance towards the treatment than others, like, for instance, Ostertagia. But this was done on a lower number of samples, so we can't, it is just an indication, we can't say this for. Yeah. So we were able to show that Hemoncus contortus had a high importance, and we had indication of a decreased efficacy of antimicrobial drugs in alpacas in Germany, and meanwhile there are some studies around showing this for other countries as well. But it is difficult as we don't know the exact dosage. So we don't know if it's really a resistance or is it just the dosage too low. So we can't say this at the moment, and there's further research necessary. But what it definitely means that we should, if we were using fenbendazole, we need to monitor this, and the fecal egg count reduction test is a relatively easy way to do this, and it is feasible for practice with the help of a laboratory, or if you have a microscope and some McMaster chamber, you can do this in your practice on your own. Coming to the take-home messages, and I see the time is over, so I'm just right on time. We see a number of South American camelids increasing in many parts of the world, so just outside of Peru. And we as cattle vets, I think, have the best qualification to start working with them, and herd health management, in our opinion, becomes more and more important as the number of animals per herd is increasing. Thank you very much for your attention. I hope I was able to show you something, to give you some ideas about South American camelids, which I find are really wonderful animals. Thank you very much.
Thank you so much, and I will give Dr. Thomas a small present. Thank you so much, and welcome to Mexico. Okay, we have to continue with our program. So our next talk is in charge of Floriana Sajovitz, and the title is Neurological Deficits in Alpaca After Microchip Placement.
Thank you for this introduction. So I'm talking today about a clinical case report that was referred to our clinic in Austria. And the patient was a 42 days old male alpaca cria. It was weighing approximately 11 kilograms at first presentation at our clinic. And it had been in lateral recumbency for the past 4 days, and it was pre-reported with severe neurological signs, as well as a body temperature of 36.4. It was shaking, apathic, and it also showed paralysis or signs of paralysis of the pelvic limbs for the last 3 days. As additional information, the owner told us that actually there was a vet's visit 4 days ago, and there was just injection of some vitamins and also a placement of a microchip. And after the farm visits, the animal was unintended at the pasture, and when the animal owner came back, it was laying on the ground and was not moving. And as it was unintended, the owner could not exclude that there was some intake of some toxic substances or poisonous plants, or even a trauma by another animal on the pasture. So this was the alpaca cria when it first came to us. So it was not moving, it was lying on the side in lateral recumbency. It was cold, wet. However, it was reacting to environmental noises. So for the clinical examination, as you have seen, it showed an epistotonus and a left lateral recumbency. However, a manual passive flexion of all limbs was still possible. and it showed a decrease in alertness, a poor nutritional status with a body condition score around between 1.5 and 2, had cold limbs, however, a pain reaction when the cervical spine was palpated was shown, and we also noticed that the neck muscles were firm on palpation. The body temperature as well as the heart rate were within the reference, while the respiratory rate was slightly increased, and also the capillary refill time were increased. And in general, the animals showed deep reddish mucous membranes. So for the neurological examination, so the cranial nerves were relatively unremarkable, except for the papillary reflexes that were delayed on both sides, and also that we noticed an incomplete eyelid closure on both sides as well. The front limb spinal reflexes were reduced in total, and for the pelvic limbs, there was an increased response. The flexor reflexes were decreased in total, but more for the pelvic limbs than for the front limbs, actually. Deep pain perception was present, which is in general a good prognostic factor, and also that the cervical spine was painful when palpated was a good prognostic factor at this stage. The proprioception for the pelvic limbs were severely decreased on the left side, while they were absolutely absent on the right-hand side. And here you can see the animal was not able to stand up or to move, so we halved it. And due to our clinical examination, we were then able to narrow down the spinal segments to C1 to 5 and or C6 to TH2. After clinical examination, we did a general health blood panel, and what we can see here is that the packed cell volume is increased, and the animal showed leukopenia. And for the clinical chemistry, we see a lot of changes, but actually the glucose was increased, the animal was dehydrated, so the total protein was also decreased, and the animal was not drinking or eating for the last few days a lot. The minerals and also the enzymes showed a slight deviation of the range. So since we were also already able to identify our region of interest, we took a CT scan under general anesthesia, and what you can see here on the left picture, there's an area with a higher density. It's in the initial part of the cervical spine. And if we now have a closer look to another CT window, we see that at the initial part of the cervical spine, there's a foreign body. And this foreign body was then identified as actually the microchip. However, the microchip was located to the left lateral of the processus spinosus and the lamina arcus vertebrae of the C2, however, it was in the muscle. So at the time of the CT scan, there was actually no indication that the microchip has actually entered the spinal canal. Since the animal was already under general anesthesia, we also did further diagnostic, and we took cerebrospinal fluid with sampling site suboccipital. And the CSF appeared quite cloudy, was containing a lot of erythrocytes and coagulated particles with an increased cell density. So the cell density was more than 200 cells per microliter, and it should be under 3. It showed a mixed pleocytosis with a dominance of reactive neutrophil granulocytes, and in addition, bacteria was present. So it was quite likely that at the time of the microchip placement, that the needle went in and damaged the dura mater and bacteria went in. We treated the animal and started with an IV with IV fluids, with a multimineral IV solution, with vitamins and additive. Also added NSAIDs with carprofen and antibiotics, as well as omeprazole. And we did physiotherapy a couple of times every day, which is also have to be seen quite critical, because normally you should not touch a cria, or at least not touch them that often. And therefore, because also the animal was referred to the clinic without a mare because he was laying down, and it had to be bottle feed, but we tried at least to do it without physical contact. So let's have a look how the animal responded to the treatment. So in general, in the first 4 days, we saw significant improvement in clinical and neurological signs. However, head trauma appeared after 24 hours. So on the first day, the animal was already able to hold its position in the sternal recumbency with an almost normal head and neck posture. On the second day after starting the treatment, was able to stand for a few minutes. He wasn't able to stand up, so we helped him, but he was able to stand, and however unable to walk. And after 4 days after starting the treatment, it was able to stand for over 1 hour, and it was also able to walk for a few steps. It was really wobbling and weak, but we saw a significant improvement. So it was able to walk since day 4, and during this day it went better day by day. However, showing a severe ataxia in the beginning, and then this went slightly better day by day. So the animal responded quite well to our treatment. And after 20 days, it was referred home with a head tremor that was still present, but mainly when the animal was stressed or when there were a lot of people around. And also it was showing mild ataxia as well. I was in contact with the owner a couple of times during the year, and so to sum up the last year, the animal was, when it was referred home, it was not accepted again by the mother, so the owners had to continue to bottle feed him. They tried to do it like we did it at the clinic, so without direct physical contact, but they were aware of that when the animal is growing older, that it could be aggressive towards human. So they are aware of that. And also the vet and the owner told us that when it came home, it was, according to them, well integrated into the herd, because at this time of the year they had a couple of crias at the farm. What the animal was is still showing is that it loses urine when it's sleeping. However, when the animal is awake, it urinates in a controlled manner. And what is typical for South American camelids, they have defecation areas, and this animal was not using them. So this can also be a sign that the animal was in its early life, was a longer time away from the alpaca herd and spent a longer time with humans. And here I also brought a video which is from the owner. It's at the farm, and if you have a closer look, it's the animal in the middle, and if you have a closer look on the pelvic limbs, you still see that it's slightly lame. But beside of that, the owner told us that there's no problem. So it can even walk also backwards, but you can see that there's a slight lameness still here. So to conclude everything, in general, the insertion of a microchip is a safe procedure, and thousands of animals are microchipped every day, like small animals, but also South American camelids. And we also took a closer look to the literature, and actually there are not very many cases reported or published in small animals or in South American camelids. There's only one, and this animal died 5 minutes after the microchip was placed. So complication may occur, but they are quite rare. And since that case, we also recommend vets that are doing microchips in alpacas not on a daily basis, that they should prefer maybe the injection site cranial to the left shoulder instead of doing that on the base of the ear, since especially in crias, there's very little tissue in this area, and there's a very close proximity to the spinal column actually. And last but not least, what is highly recommended or even needed, and we think that this was also the problem in this case when the microchip was placed, is that a proper fixation of the animal should be done by a trained person, just to reduce the risk of avoidance movements and also to reduce the risk of such complication like in our cases. So I'm at the end of my presentation. I want to thank you and happy to answer questions if there's time.
Is there any questions? Can you come here to the microphone in the middle, please? Well, I have a question. So the use of the microchip is very common to these animals, or it was just because it belongs to the zoo, or what is the typical rule for tracking the animals in your country?
Thank you for the question. So in Austria or in Europe, there's actually a law that says that this animal has to be identified, so either with an ear tag or with a microchip. As my colleague, Professor Wittek, already said, since they're going on shows, so it's not really common to have ear tags in South American camelids, so the owners preferred placing a microchip. And they should do it at least when the animal is moving around or in or export, or if they are 9 months old, they have to identify, or put it something like to identify the animal, just to keep a track.
So it's from the government? So
yes.
Okay. Yeah. Do we have some more questions? Okay, please. Thank you. So we can continue with our next talk that is called "Can Limiting Stress Be Part of Managed Treatment in Alpacas? A Case Study." Is in charge of Marilena Bolcato.
Good morning, everybody. Thank you for the presentation. So let me introduce just a brief introduction of the term stress that Professor Wittek has explained very good today in the morning in the keynote speech. So the term stress refers to several changes in behavior and in physiological parameters of the animals, and will be induced by external stimuli that could be chemical, biological, but also external, like the presence of people, the stain, the pain, hot, very hot temperature or very low temperature. And of course, the main stressful condition for animal will be illness. Illness is per definition a stressful condition, and if you thinking that an animal that is ill and in stress and has also to be handled and underwent clinical examination or maybe a treatment that could be invasive for him, this stress circle could be increase and exacerbate the situation. So our story starts in June when 3 alpacas, very young, ranged from 5 to 6 months, were purchased from an educational farm. We call it educational farm, this kind of small farm. It's like a zoo, it's not production farms. So they keep some different species of animal. I mean, 3 cows, maybe 5, 7 goats and sheep and so on. And they purchased these 3 animals. They had a long trip, 300 kilometers in June season, that in Italy is a spring season, so quite hot temperature in that season. And they change in the environment from a big pasture where they stay with a native group, just in the small paddock. Sorry. So in July, after 1 month, they showed a reluctance to human approach, hide from the visitors that went to the educational farm, and poor appetite and, of course, stunted growth. In August, that it's holiday season in Italy, it's the middle of the summer, they starting to show less discomfort towards the less visitors that were in the park, and fortunately increase in the appetite and of course in the body weight. Unfortunately, in September, this peaceful condition ended because the schools are opened again and school trips come again in the educational farm, more visitors and so on. And the 3 alpacas were also referred in the meantime for a dermatological problems. So at the first day of calling, we performing a clinical examination of the animals. I'm going to show you some images of them. This is alpaca number 2. It's the oldest one of the group. He showed this crusty lesion, especially on the ear pinnas, in the sternal and axillary region, in the belly and in the medial part of the hind limbs and in the perineum region. As you see, the skin is very pinkful and crusty and wrinkled. He shows also itching, and for the physiological parameters, tachypnea, tachycardia, but no increase in temperature. Alpacas number 2 shows mainly the same clinical signs, more in the muscle and in the axillary and in the sternal region. He shows no itching and again increase in breath and pulse rate. All the mucomembranes were, in this case, pink. And finally, alpaca number 3, he shows the mild signs of the trees in the axillary region and in the perineal region. Again, the physiological parameters were increased except the temperature, and the mucomembranes were pink. The same day, we performed also a macroscopical parasitological examination of the feces that fortunately were negative, and skin scrapings from all the affected sites from all the animals. And you can see here the result of the skin scraping, a diagnosis of the presence of Sarcoptes scabiei was done. So, easy diagnosis, not so easy treatment, because there is in Italy no licensed ascaricide resistor for camelids, and also looking at the references, there is no many data about that. For alpacas, you can see we can find some, you can see we can find some options, so subcutaneous plus topical ivermectin, maybe subcutaneous ivermectin and topical fipronil, or 2 ascaricides and chlorhexidine shampoo. In any case, all these treatments were not available in the educational farm, for example, shampooing the animal will be too complicated and takes a lot of time. Moreover, as we can say, the animal showed a lot of stress before the illness, during the illness, so maybe do it 2 injection or maybe 2 injection and adding a shampoo could be too much for the animal. So in literature you can find that for shamas looks very good treatment, the subcutaneous ivermectin at the dosage of 0.2 milligram per kilograms. So what we decide to do is doing this treatment repeated every 7 days for 4 times totally. And during each treatment, we also collect the behavioral and physiological signs showed from the animals. At day 21, the animals showed a clinical improvement, more for the alpacas number 2 and number 3. Alpacas number 1 also show some crusty lesion, more in the abdominal region and in the medial part of the hind limb. And regarding the stress, factors that we identify was vigilance in running, trying to escape, jumping, and vocalization. And for the alpaca number 3, that you remember was the last one, the younger of the group, he also showed urination and muscles tension. In all the days that we performed the treatment, the tachycardia and tachypnea was also recorded. At day 21, we perform again the skin scraping that shows the absence of Sarcoptes scabiei, but unfortunately, Coreoptes bovis becomes. So the option here was to decide if treatment again the animal or continues the treatment or changing the treatment or maybe doing nothing. So this was our choice. Just leave the animal in peace, just relax them and see what happens. So what we going to do it was just control by only inspection the animal every week for 4 weeks. And finally, after 4 weeks, we perform again the skin scraping and we detect no presence of any kind of ascaris. After 3 months, they look really nice. The wool will completely regrowth. The body weight would increase. They change in really behavior with the visitors. Unfortunately, not with me. They still hate me after this long time, but you know I'm a vet, so it happens. And in conclusion, just a reminder for you that the stress has been found directly to connect to a plethora of disease in human medicine. We know it very well in our pets like cats and dogs. We know also very well that could be connected with, for example, gastrointestinal function, just thinking about the ulcers of the abomasum or the C3 in the case of South American camelids, but also changing in intestinal microbiota, the immunosuppression that could be lead to other disease or increase the state of illness, but also pain perception, wound healing, and of course cutaneous diseases. And although in pets and in human medicine, the influence of stress on health is really acknowledged, will be awareness also in the veterinary field for the South American camelids and in ruminants in a bigger way. And the identification and management of the stressor could be a fundamental and integral part of the therapy, especially in these species that are particularly susceptible to stress or already in stress. So I hope I didn't stress you, and if yes, let me to suggest to go to another beautiful place in South America that is the province of Salta La Linda in Argentina and see some wild and happy alpacas, and thank you for your attention.
Is there any question? Yeah.
Mic on? Okay, now we are. As you found the scabious variation of the Sarcoptes, this is zoonotic. Have you, in just the educational form, have you heard about any human cases? I mean, there might be children around touching, or were they so negative against visitors that they haven't been touched?
No, so scabies in Italy must be notified for sure, and we notified and just put it some advertisement around the paddock of the alpacas that people has not were not allowed to go so near to the animal, but from the part of the educational farm, they didn't want to remove the animal at least for the period of the treatment. So it's authority, it's not the vet, they have to decide, but in that case they didn't do nothing against it. And fortunately we don't have any human cases. Also me, I don't have it, so was a good. I don't detect it, no, at all. Thank you.
So, are those animals were in contact with another species?
Yeah, thank you for the question. Yes, not really in the same paddock, but near them there were sheep and goats, but that were controlled, and there was no detection of Sarcoptes scabiei in them, but they were preventively treated 2 times per year. I have to say that before the arrival of these animals in the pen, there were other species, and I'm not really sure about the real disinfection that they have done in the paddock. So this is another point that maybe has led to the mange in the alpacas.
Do you happen to have a list or advice on which stressors are out there for alpacas other than handling?
So for the physiological parameters that you can recognize, you can see the increase in breath rate, in the pulse rate, sometimes in temperature. For sure, they shows a stress behavior. I mean, increase in vigilance, try to escape, running, vocalization. Sometimes they split or they try to bite you. Yeah, I think that it's the main and the most recognized signs of stress that you can see in this animal. But they are really, as in the keynote of Professor Wittek this morning, so also when they are trained to be handled, for example, for shaving, they can show some stress. I mean, in that case, they were really young animals, so 5 to 6 months, and probably never handled in the farm, in the original farm, just living in the pasture. You can train the animal for sure, and they don't feel it any stress. We in Europe organize some trekking with the alpacas, picnics with the alpacas, and they look really relaxed, but you have to train the animal. So give them some time to, could be also an option, show them where is the table for the shaving, just put them, but don't shaving them. So it's like a training, yeah.
I'm sorry, I'm extending my question. We're in the place where I come from Florida, and they have alpacas in Florida. Yeah. So in that terrible 90 degrees and 80% in humidity. But so we do see a lot of alpacas that die of ulcers, but it's a lot of, and parasites, those two. But the stressors, I don't know. I don't know how to advise the clients. I cannot tell them don't have alpacas, period, but how to provide like some feedback on the, to reduce the stress, because I know that's the cause of death, but what did they do? I just don't know. So if you have a list of, I know probably by handling, make them get used to people, but what other stressors might be out there? So to give some advice to the producer.
So they are prey species, so thinking that as a prey, they can be stressed for everything. I mean, so maybe don't change the environment, just choose a place that could be place food, not allowed. Sometimes they put it in the garden as a pet with the dog. So barfing of the dogs, or these small dogs like the Chihuahua that you have here, they also barfing, so could be a stress factor for an animal that is not used to have a dog or to live with the dog. So at the beginning you can just divide the space and allowed only the inspection of the two species, but not the contact immediately. But so in Europe we don't have actually and currently an indication or some real procedures about the welfare of this animal, and it's something that we have also discussed with other colleagues. Could be a must to do it some welfare procedures for this animal. Thank you.
If I might comment, in this case, these animals had been weaned at an age of 7 months, which is certainly too early. Just certainly too early, and no wonder that they have a stunted growth and develop this kind of disease. I mean, do you agree with that?
Yeah, they are really young. Thank you.
Thank you so much for the talk. Our next talk is a study of composition of alpaca colostrum for Thomas Wittek.
Thank you very much. It's the second presentation. It's actually the work of Maria Geyer. She's was a doctoral student, did her PhD on the composition of alpaca colostrum and alpaca milk. I'm just talking about the colostrum today. And just for a short introduction, the alpacas and llamas as well have an epithelio-corional placenta, meaning that there's no transfer of immunoglobulins into the cria. So the crias, as we know it from lambs, calves, and kids, are born without immunoglobulins. And so, similar to cattle and sheep, it needs to be transferred feeding colostrum or suckling colostrum at the dam. And it is also the same situation that there is a time window for crossing the immunoglobulins through the intestine into the system of the cria, which is also similar, we all know, from cattle. And we see a risk of failure of passive immune transfer after dictyocaulus. So if the cria is rather weak, there are some cases of an aberrant behavior, so especially young females ignoring the cria, or sometimes even attacking their own offspring. And of course, in some cases, the mares don't have any colostrum, or they may have died during or immediately after parturition. In these cases, we need alternatives, and the best way would be frozen colostrum from the alpacas, but it is very rarely available. And so there's colostrum from other animals used. We know that the immunoglobulins are absorbed, but we don't know if it has any protective effect. We simply don't know this. And there are some commercial replacement products having very variable quality. Some are called colostrum replacements, and they don't even have any immunoglobulins in the product, so which is sometimes interesting. Anyway, there are very little amount of knowledge, very few studies available, and so we thought it might be a good idea to do something to have a little bit more information. And what we tried to measure is, of course, the immunoglobulins, but also the protein, fat, and lactose content. We also measured minerals, but I'm focusing on immunoglobulins, protein, fat, and lactose. And we tried to estimate the changes over the first 4 days, meaning the colostral period, looking at this. Yeah. We had a smaller farm in Styria, which is a federal state in Austria, and these alpacas were kept. They were all they had all more than one birth after them, so they were not primipar, they were multipar, and they were kept a little bit in a mountain area in a height between 800 and 1,100 meters above sea level. And we took the first sample on day 1. Day 1 was the day of the parturition, 2 to 4 hours after the parturition, and then we tried to take another sample every day till day 4. So we planned to have 80 samples. We ended up with 77, as one of the mares unfortunately died on day 3, and one other developed a mastitis, and we couldn't use the milk any longer. But 77 was quite a good number of samples. We used the gold standard for measuring the immunoglobulins. There's a commercial test available. There's the radial immune diffusion. It's a rather laboratory-based method. It can't be used as point-of-care test. Takes time, at least a day, and it has to be done on a laboratory, in a laboratory setup. So we used classic methods to measure fat, protein, and lactose. So it's the gravimetric Weibull-Berntrop method, the Kjeldon method, and UV lactose, the galactose method, and we used automatic machines, devices to measure the minerals in the colostrum. So a little bit about statistics. We used a mixed linear model with a random effect to having repeated measures, and then the significance level was set at 5%. Coming to the results, as you can see here, this is immunoglobulins, and it was a decrease, as you can see, from day 1, this is the day of birth of parturition, to the day 2, 3, and 4. That's what we expected, and that's what we know from other animal species as well. What we did not expect, look at this wide variation. It is a huge variation between animals having the same, coming from the same herd, having the same feeding, and there were no primipary animals. This was something which we really were surprised. We repeated, we were surprised, we repeated the measurements, and we came up with the same results. So this is something we haven't found in the literature yet, although there is very little literature about this. So maybe it was not really identified in the other studies which are available. Looking at the protein, it's about the same figure. The big step between day 1 and then to day 2, 3, and 4, but it is still, day 4 is still higher than the milk and the later in the lactation. And again, a wide variation between these animals, which we saw also in the protein concentration. Fat, starting with very low concentration after parturition, it was almost 0 in some animals, in some other animals, but a little bit higher. But as you can see here, these are 2%, and then there's an increase, numerical increase, but statistical difference between day 1 and day 4. And at day 4, we are about at that concentration or percentage 4.5, which the milk later in lactation only have. So this is reaching the concentration. Not as much fluctuation, but also a wide individual variation in lactose. There was a difference between day 1 to all other days, as you can see here. We looked at the associations between the parameters and saw a negative association, not relatively strong, but not, let's say, not highly associated between immunoglobulin. Here we are. Between immunoglobulins on one side and fat, but also between immunoglobulins and lactose on the other side. But there was a very, very strong association, as you can see on the right side, between immunoglobulins and the protein concentration. We also calculated some association to the minerals, and we saw that in the first colostrum, so day 1 colostrum, with a couple of exceptions, sodium, potassium, manganese, and molybdenum had the highest concentration and dropped at day 2 then, and there were 2 associations, significant association and rather strong association, as you can see on the graphs here. The first between IgG and magnesium, and this has been known in other animals and also in humans, and that the colostrum is rather rich in magnesium, and the explanation behind, I don't know if it is true or it might be just a theory or a hypothesis, is the magnesium reacts as laxative. So just to get rid of the meconium, there's some higher concentration of magnesium, just passing feces easier for the. I have no idea about the importance or the association of the immunoglobulins to cobalt. If somebody of you has an idea, just drop me an email or talk to me about this. I have no idea what significance this has. To summarize this a little bit, the IgG concentrations on day 1 are similar to results of other studies. So we are in similar regions, but there are not many studies available. So, and they decreased as we expected over time, which is also similar to other studies. There are some studies around which didn't use the radial immune diffusion, but they used an ELISA instead. And it seems that the ELISA is not working very well. There were no association between ELISA and the standard the gold standard, and the measurement range was completely different. So it seems that the ELISA is not working in camelids as it might work in other animals. So, we had a very low fat concentration. This was similar in llamas, but this llama study was just done in 9 animals, just taking one sample. So the data situation is not great, as I already told you. The close association between IgG and protein is really so strong that the protein concentration could potentially be used as a proxy, as an estimate for the immune globulin concentration. It means similar in cattle, it might be suitable to use a Briggs refractometer. This is the study we are just working at, trying to validate the Briggs refractometry in colostrum for New World camelids, and we see what we get in a couple of weeks. Then we're just sampling. This is the season where the crias are born, so we're just about to sample. This is what I like to share with you, and it was a kind of surprise what we got here, especially the individual variations, and therefore we think it might be a good idea to advise the farmers to actually check the colostrum quality, even if the crias seem to suckle their mothers rather well, if the colostrum quality can be rather low, and this could be the explanation why some farmers reported, I have seen the crias several times drinking at the mother, and I had the impression that it got enough colostrum, but it fell sick later, and we couldn't find a high IgG concentration, although the farmers reported that were drinking well. Thank you very much.
Do we have some questions for Dr. Thomas? Yeah, please come here to the microphone.
Thank you for your presentation, and I'm sorry if I missed it, but I just wanted to see what your opinion is on what's considered good quality colostrum for camelids and what sort of range of IgG you saw in your study, so minimum, maximum, and mean. And then how much IgG does a cria need to consume to achieve adequate transfer of passive immunity?
I was afraid of this question. Could I go back to the presentation? Is this possible? We don't have any good data as the number of samples we checked. We tried to calculate it, but we came up with a variation which is simply too wide. So we need more data. If you're talking about IgG concentration in blood of crias, there is a recommendation in the book of Chris Zebra, and they're saying they would expect 2,000 milligrams per, but they don't give any studies. So it could be just experience they have experience, but we don't have data. This would be the over next step we're trying to do. But I just, if we look at this, you see the differences. If we would just calculate the median, this would be between 20 and 30 milligrams per deciliter. So, but as the variation is too high, so I wouldn't dare at the moment to say this is the range. But if we would just use the average value, this could be a start to work with, but I wouldn't dare to give any recommendation for a range at the moment.
That makes sense, and the answer is probably going to be similar for the total proteins or total solids, but
Yes,
you mentioned there's a good correlation.
And I hope that bricks will work. I can't see any reason why it shouldn't. So it would make it much easier, as the radial immunodeficiency is really cumbersome and it is expensive, and it's not for daily use. So hope that we can develop something which can be used in the field.
Great, thank you.
More than welcome.
Thank you for the interesting presentation. I'm from the UK and we're doing quite a lot of plasma transfusions at the moment, so always keen to prevent getting these cases. I wondered if your results helped to perhaps or changed your perspective on what the best replacers would be, what colostrum replacers you would recommend, perhaps based on what you learned here.
There are studies showing that immunoglobulins from other species are absorbed, but we don't know if they have any effect. We simply don't know. So, but if you would give the recommendation to use cow colostrum or sheep colostrum, it might offer some protection, and I would suggest it is better than nothing. I'm rather skeptical about the majority of commercial products. There are some good available, but they're really expensive and they're produced out of blood. So they take blood and they separate the immunoglobulins and then they are frozen and then they can be used. But they are really expensive and then they expire rather quickly. So this might be something for large farms, not for the small farms. So I would actually recommend to trying to milk older females having high amounts of colostrum and trying to milk them and use then the brick refractometer and looking if the colostrum is any good and then freeze them. This would my recommendation at the moment, and it needs experienced breeder, of course, who is able to decide is there enough colostrum for the cria and for freezing, or is it not? But the experience shows that especially some of the older females, they have enough colostrum. So this would be, I think, my number one.
Thank you very much, and I think the work on bricks is going to be really useful because I think we have a lot of owners who would want to do it.
Hope it's going to work.
Yeah, thank you.
Yeah, thank you very much for the question.
Do you have another question for Dr. Thomas? Well, I have a question. It's related with the fat concentration in the colostrum. So do you think the lower amount of fat is related with something? So the behavior of the alpaca, or compared with another species, what do you think is happening?
It's, to be honest, it's just speculation. It's just speculation. It might have something to do with digestibility, so that they may not be able to digest fat in the very early days of life. But this is just speculation. I'm not sure, and I may need to talk to nutritionists, but this was my idea about this.
Thank you, Dr. Thomas. Yep.
Yeah, thank you very much.
I think we are finished with the talks in this room, so we have time to go to the exhibition hall in the ground hall if you wanted. Thank you.
Okay, good morning, ladies and gentlemen. I'm Ulises Bautista. I will moderate the area of short communication. And in this area, you will not see conferences about researches, maybe with not material and methods, maybe neither statistical conclusions, but the importance of this area is that the vets that are working in the field, practicing clinic, medicine directly with the animals, with the ruminants, wants to share us experiences, opinions, or clinic cases. As the first conference, I would like to introduce you Dr. Elke. She is full professor at the College of Veterinary Medicine and Zootechnics in our main university, the FMBC UNAM, and researcher with 7 years of experience in dairy cattle production and parasitology. She's member of the National System of Researchers in Mexico with 19 peer-reviewed scientific publications. A speaker and keynote speaker at over 38 national and international scientific conferences, symposiums, and workshops. Supervisor over 14 undergraduate and graduate students. She obtained her college degree in veterinary medicine and zootechnics from the UNAM, our university, doctoral degree in animal production and health science. She passed with honors and awarded with the Alfonso Caso Medal of Merit, in 2019 by our university too. And performed a 10-month research stay at the Institute of Parasitology and Tropical Veterinary Medicine in the Department of Veterinary Medicine in Free University of Berlin in Germany. The line of research used the plants and their bioactobic composed of parasitic control in small ruminants, cattle, and fish production. Phytochemicals as sources for the development of novel therapeutic leads for parasite control in livestock production and biological control of cattle parasites. So, Dr. Elke, thank you very much,
Ulises. And, well, hello everyone. Thanks for being here. I would also like to thank the scientific committee for the invitation. And I think that I would start with a question, why parasites? So yesterday we had over 10 conferences, pretty good conferences regarding the parasites. And I will answer that question myself. And I think the answer will be reshaping production practices to foster resilience and long-term success of the cattle production. And why is that? Understanding parasite control in modern times, it's not longer about just selecting a chemical or a deworming season. There are two main concepts that should be considered and kept in mind, which are sustainability and consumer preferences. Because these two concepts are actually reshaping the market nowadays. Understanding consumer preferences in the context of livestock products means that consumers are seeking for food safety, quality, animal welfare, sustainability, and transparent information. And that means they want to know what's happening with the rearing cattle and to the table, right? So consumer awareness of animal ethics and environmental issues is putting pressure on livestock production. And that is a fact. So the market is being reshaped, and with that, the practices are being reshaped. So meat and dairy markets are being influenced by sustainability, societal, and health concerns. So it is a fact that alternative systems will grow in the overcoming decade, that gas green emission will reduce, fostering these new alternative systems. Meat consumption, dairy consumption will also grow. And another fact is that 44% of the consumers are actively seeking for organic products. So as we can see in the graphics, that is a tendency, and that is a projection, and that is a reality. So if we don't reshape production practices to meet the evolving market, well, the answer is maybe sustainability of livestock is not ensured. I would like to make a note that we are facing emerging alternatives of food too. We have plant-based meat, and nowadays we have lab-grown meat, which is already a reality. And even though they have a very small market share nowadays, like 1%. And lab-grown meat is not yet a problem. However, it has been already estimated that for the next 10 years, it will be a competitor. In Europe, it's being already sold in restaurants. And maybe right now, this 10-year window we have is because we don't have the acceptance and the price is too high. However, we have this 10-year window to reshape our practices and meet the consumer's preferences. So much work has been done on that regards. So we have some current and future challenges, which are, we have problems with land use, climate change, water scarcity, and of course, social acceptability and consumer preferences. So, long story short, farmers and veterinarians are facing nowadays several challenges where they have to rear cattle meeting the standards of animal health, welfare, performance, economic viability, social acceptability, ecological balance, and sustainability. So, that was exhausting, right? So, livestock farmers and veterinarians have to be prepared to face these challenges. And we have a window, a 10-year window. So much work has been done to offer alternatives to meet these demands of the market, which are silvopastoral systems, organic system, and grazing system. However, these outdoor rearing systems come with specific risks. Some of the risks are food and water scarcity or poor quality of food, problems with the shade, maybe too much shade, maybe not too much shade, that also affects the fed stuff, predation, and, as being highlighted here, parasitism. And if that was not enough, people are seeking for chemical-free livestock products, right? So we have to achieve all these challenges, and now without the use of chemicals, which is not an easy thing to do. So now we have a goal, which is reshape production practices, but we need a plan and we need a strategy, and for that we need the tools. And we have to get to know our belittled enemy, which are parasites. So the degree of parasite infection will depend on many factors, including host, environment, and management. However, it is important to get to know a little bit of biology, a little bit of the life cycle, or the patterns of infection to introduce the adequate tools for their control. So getting to know our enemy, there are several parasites, nematodes, helminths, you name it, right? But we're focusing this conference on nematodes, which are one of the main health problems in grazing cattle. So there you have them listed. There are several parasites, over 20 species affecting gastrointestinal tract, and the last one, which is Dictyocaulus viviparus, which is the lungworm, which also causes a lot of problems in the grazing cattle. Talking about life cycle, so I'm not gonna give you a lecture of life cycle, which is important that for gastrointestinal nematodes and for Dictyocaulus viviparus, even though they do differ on the complexity of the cycle is pretty much the same. They have a direct life cycle divided into two stages, the pre-parasitic stage and the parasitic stage. That includes pre-parasitic stage, That is, when eggs are shedded in the feces to the environment. And that goes the development of the larvae to the infective larvae, which is ingested within the grass, and comes the parasitic stage within the hosts. So, this is important. Why? Because as here is being said, 80% of the parasite population in my farm is in the pastures. And the control is focused nowadays, targeting on the hosts, which only fosters 20% of the parasite population. That gives us a picture of a real problem nowadays. Another characteristic that I will have to mention for Dictyocaulus viviparus, and it's regarding epidemiology, would be the presence of a fungus called pilobolus fungus. This fungus is important for epidemiology, and I'm mentioning it because later on we'll talk about a control tool for this fungus. And this one is important because it grows in the feces, as seen in the picture, and the infective larvae of Dictyocaulus will exert a vertical migration to the sporangia, which is this one, and then it will get filled with water and explode. And it will propel the spores of the fungus with the larvae up to 3 meters from the fecal pad. And that will allow the distribution of Dictyocaulus viviparus. So actually, controlling fungus sounds like an important tool to avoid the dissemination of the parasite in my pastures. Overall, the epidemiology of parasites, we could say, well, epidemiology is affected by anthelmintic resistance, climate change, and of course, farm management, right? So the overall prevalence in farms has been reported to be between, or in a range of 40 to 80% for gin, and pretty much the same for lungworms. Parasitic diseases is without a doubt one of the main health problems affecting grazing cattle. And it affects animal health, animal performance, and of course increases production costs due to treatment and management. Several reports, and yesterday we had an amazing conference from Dr. Stridham talking about the impact of, or the costs of parasitosis in beef cattle. So it also happens in dairy. It's the same thing. It has costs, and it has been reported that the milk drops could achieve 50%, the quality of milk is decreased, we have problems with body condition, fertility, even mastitis in the case of lungworms because of the continuous coughing during the milking process. Mortality, morbidity, costs of diagnosis and treatment. So overall, it has been estimated that Dictyocaulus viviparus has a cost between 160 to 170 euros per cow, while in Mexico has been estimated a cost of $445 billion a year, just in matter of the production losses without the cost of treatment. So this gives us like a general picture of the big problem we have with parasites nowadays. Without a doubt, the use of chemicals has been the cornerstone of parasite control. And it is okay, it has brought a lot of benefits to the industry. However, the not so very optimal use by farmers mostly has led to anthelmintic resistance. So we have just a few molecules that can actually control parasites, and the anthelmintic resistance is a very worrying scenario, especially in tropical regions. There are several reports, both for gin and for Dictyocaulus viviparus, regarding anthelmintic resistance, and we have not only resistant strains of parasites, so multi-resistant strains of parasites, of course affecting our ability to control parasites in field. So, that being said, novel approaches for helminth control are necessary to establish integrated, multifaceted, and sustainable schemes of parasite control. And we can classify the novel approaches into two. Infrapopulation control, which includes the parasites within the host, which includes, of course, chemical control, immunological control, and the use of bioactive plants. And we have suprapopulation, which controls the parasites in the pastures. And that has management tools and biological control tools. Regarding management, I would say grazing management should be the first line of defense against parasite infection in cattle. Why? Well, as we said before, 80% of the parasites are in the pastures. So we have some epidemiological tools for modulation. That would be the effect of dilution, mortality, or wipeout effect. And I will explain pretty quick. Actually, so this conference could be a 3-hour conference. So pretty quick, the dilution effect. How can I achieve that? And one option is to use silvopastoral systems. Silvopastoral systems combine the use of forages with trees and shrubs. This allows the animal to exert behaviors of grazing or browsing. And of course, that will decrease the amount of larvae or infected larvae that are in the grass to be ingested by cattle. And of course, we can lower the worm burdens inside the host. Furthermore, this system provides biological diversity, that is, protecting soil fauna, that could also help us to control parasite populations, like biological control tools. Depending on the plants we are including in our system, it could help with immunonutrition, and it could also help with the presence of plant secondary metabolites, which have anthelmintic-like activity and could also exert a control tool. The second would be mortality. And well, the main principle of this effect is rotational grazing. With rotational grazing, we only have to take care of the stocking rate, dividing pastures, having periods of use and rest. Usually, it has been reported that the peak of parasite mortality in the pastures due to the environment exposition is achieved around the 4th week, between 30 to 40 days. So allowing the environment to do their work will allow to larvae dying from starvation or desiccation, and by that, reducing the infectivity of the pastures. And the last but not least would be the wipeout effect. This alternative is mixed or alternated grazing. And it has two principles. One, or the first, is to the combination of productive species that cannot be infected by the same parasite. Meaning that we can combine cattle, sheep, cattle, goats, cattle, equines, cattle, deer, and they would control the parasite infectivity in the pastures. The other is the combination of physiological stages that would be adult and calves. And that could help us, or it has been proved to help by reducing the infectivity of pastures up to 83%. So that would be management, epidemiological tools, but we also have biological control. And biological control, it's a man-made alternative to use live natural agonists of parasites. And we have nematodes, bacteria, arthropods, and fungi. I will be only mentioning the ones I consider most representative due to they have been assessed in vivo, which is bacteria with Bacillus thuringiensis, arthropods, dung beetles, and with the fungi or nematophagous fungi, the Dictyocaulus flagrans. Bacillus thuringiensis is a bacteria that can survive the gastrointestinal passage, has an in-feces sporulation, production of a crystal protein. This cryotoxin will be eaten by the developmental stages of the larvae within the feces. This protein binds with the glycolipids of the microvilli, causing a vacuolization, leading to the death of parasites. It has a high specificity against insects and nematodes, and it has been reported that it can reduce 20% of the fecal egg counts in field. And most importantly, 20% is not that much, but that's not our target. That's within the host. Our target is in the feces, and it has been proved to reduce in 95% the amount of infective larvae in feces. There's no scientific evidence to support this activity against Dictyocaulus. However, due to the similarity of the life cycle and development of the parasite, we would expect it to work too. Second would be arthropods, dung beetles. And dung beetles are some magnificent creatures living in the soils that have a lot of ecological services. And one of them would be modulation of parasites in the pasture through feeding and reproductive behaviors. This tends to make these little balls of feces and bury them, and that's part of the reproductive behavior. And this could help us to modulate the parasite population within the grass. However, some authors also note that this could also be a time bomb effect, which is, well, the parasites are kept in the first layers of the soil, and then they have like the best environmental conditions to be well protected, and exert the vertical migration through the grasses and infect my paddocks when the environmental conditions are better for the continuing with the life cycle. That is partially correct. Some work that we have done in Veracruz, we saw that it depends on the species of the dung beetles. So there are some dung beetles that are not deep tunnelers, and when they are not deep tunnelers, they do lay the eggs in the superficial layers of the soil, acting like a time bomb effect. However, some species like Copris incertus, Dictyocaulus gazella, those are deep tunnelers. So we only assessed up to 25 centimeters down the soil, and we saw that larvae, when buried from 10 to 25 centimeters, they cannot exert their vertical migration, and by that, their life cycle would be interrupted. Pretty much the same was observed for Dictyocaulus viviparus, with a reduction of first-stage infective larvae in feces up to 84%. And, as I mentioned before, Pilobolus, the fungus. It has also been proved that the presence of dung beetles can reduce the sporangia of Pilobolus in feces in a range from 50 and up to 80%. That is important. Why? Because some studies have reported that paddock-free, or Pilobolus-free paddocks, would decrease larval excretion up to 90%. At necropsy, they found that these Pilobolus-free paddocks, the adult worms were decreased in 85%. So it's actually a very important numbers that would allow us to control parasites within the pastures. Finally, we have the finally for this part, we have nematophagous fungi. These have been, over the past decade, pretty much assessed in vivo and in vitro. And the main mechanism of action, as you're seeing right now in the video, is the chlamydospores of this fungus survive the gastrointestinal tract. They colonize the feces, germinate, and create these tridimensional traps that will trap the larvae within the feces, penetrate the cuticle, generate an infectious bulb within the larvae, and they will digest their content, basically. That's how they work. And the results that have been proven in vivo against sheep, cattle, and goats, it's pretty interesting because the reduction of infective larvae in feces could be between a range of 50 up to 80%. And there are some other species of nematophagous fungi that they also act against Dictyocaulus viviparus with a reduction up to 50%. and some other species like Arthrobotrys, Poconia, which also have activity on in vivo trials. So that was for suprapopulations control, and the last part would be control of infrapopulations, which is within the host. So, as being said, it refers to the control of parasites residing inside the host, which is that 20%, which we already said, we can control it with chemicals, immunological tools, and the use of bioactive plants. So chemicals, we already mentioned them, and the focus right now is on the alternatives. So immunological alternatives, well, here we have a little problem. So we have vaccines. There are 2 available vaccines in the market for the control of Haemonchus contagious for sheep and Dictyocaulus viviparus. However, there are some limitations. And one of them is it's not available worldwide, and it has many other limitations. However, much work has been nowadays done regarding hidden antigens, excretory and secretory antigens, and recombinants. So with the work that has been performed worldwide on regards of proteomics and glycomics, even though nowadays we don't have an optimal vaccine, it is expected to be present in a couple of years, either a recombinant or synthetic helminth vaccine by the year 2030. Immunology. Microbiome is growing interest in cattle. Why is growing interest in cattle? Of course, a healthy gut microbiome has been related to a better performance, better fat conversions, better milk production, immune regulation, and inhibits or reduces parasite establishment. So we know that parasite infections cause dysbiosis, inflammation, immune deregulation, and increases the proteobacteria, which has been associated to alterations in the carbohydrate metabolism. So parasites and microbiome has been recently studied and has been found to be a close relation between them. And it has been proposed the use of prebiotics to control or immunoregulate the cattle in order to achieve a parasite control. So what are prebiotics? And those are non-digestible dietary components that allow the growth of beneficial gut microbiota. And for that, we have oligosaccharides and polysaccharides that has been proven to increase lactobacilli and bifidobacteria within the host. Examples, the use of inulin, tannins that are present not only as fat additives, we could also use plants like chicoria or some tannin-rich plants that would actually act as prebiotics to allow us to improve the immunological system of cattle. Last but not least, the use of bioactive plants. And well, the main principle of the use of bioactive plants would be the ethnoveterinary, which is treatment of diseases with the use of plants. And the origin is the presence of plant secondary metabolites, which are allelochemical compounds present in the plants that are part of the chemical defense or the environmental interaction. So there are several groups of these plant secondary metabolites that could act with anthelmintic-like activity, mainly alkaloids, phenolics, terpenoids, and glycosides, that could have a direct or an indirect activity against parasites. And also it could be preventive or curative. There's much work done on in vitro trials, assessing the mechanism of action of plant secondary metabolites. Some of the mechanism that have been proposed is many of these secondary metabolites act against collagen-like proteins, which, by the way, represent 80% of the proteins of the cuticle of parasites, affecting hemidesmosomes, which are attachment organelles for the addition of the cuticle with the epidermis of parasites, affecting sarcomeres, that are the musculature cells of parasites. So overall, we can see that they do affect locomotion, and in general, we also can see some apoptosis and mitochondrial swelling, among many other things that has been assessed on in vitro tests. So this in vitro information supports the in vivo trials. So in vivo trials have also proved that the use of bioactive plants could help reduce parasite populations within the host, or either to prevent or to cure. So this is an example of Gliricidia sepium, which is a tropical plant that has been proved and has been assessed that it could help reduce parasite establishment up to 80%. At necropsy, the worm burdens were reduced 30% with reductions of fecal egg counts and fertility of female parasites up to 40%. There are some other plants from temperate regions like Chicoria, that is also known as the anti-ostertagi plant, that has the ability to reduce adult worm burdens in 66%. Onibrichis bicifolia, also known as Samphuan, that also has an excellent activity against ostertagi. And we have many other plants. So some of the latest are the use of pomegranate, that also has a fecal egg count reduction up to 90%, 50%. So we can see that the efficacy has a range. It's not, of course, it's not 100%, but it all ranges between a 50 and an 80%. Another concept that's being studied nowadays is circular farming. For that has been proposed the use of agro-industrial byproducts containing tannins to control parasites and fecal egg counts. It has been proven, or this investigation demonstrates that the use of hazelnut, chestnut, carob, bark of temperate or tropical trees, spent coffee grounds, or even cacao pods could reduce fecal egg counts in the field over 50%. So we have like a lot of options, a lot of tools. And I think the last concept that I would like to leave in you would be zoopharmacognosy. And zoopharmacognosy is the animal's ability to self-medicate. And it has been proven that cattle exert this type of behavior. And cattle that is infected with gastrointestinal nematodes, it's tend to consume plants that also have bioactivity properties, like nutraceuticals. So there is a replacement rate of the diet from grass to bioactive plants, tropical legumes, for example. So I would like to finish this slide with saying that the inclusion of bioactive plants within the farm will allow zoopharmacognosy to occur naturally, and by that, helping us to control parasites. That being said, the notion of one drug, one target, one disease is pretty much naive. We have to consider a multifaceted program. For concluding remarks, I would have to say eradication is not the key. There are several tools that could be used just to maintain worm burdens compatible with welfare and performance. We have to keep in mind that in the host, we have only 20% of the parasites population, and in the paddocks, we have the 80%. So controlling them, considering the pasture management, will also allow us to have a better management of parasites. And of course, less negative impacts on production parameters. Tools efficacy. With tools efficacy, I mean, so nowadays, many of the chemical products we have available have an efficacy ranging, well, depending on the chemical, between 50 and up to 90% of efficacy, right? Because resistance is here, and we all know it. So we have other tools that could have the same range of efficacy. So the thing here is to combine efforts. It's not to say that do not use chemicals, not use them, but use them wisely, no? And as it should be used. And if not, use the alternatives. Create a multifaceted and individualized parasite control scheme for your livestock production unit. So the great challenge is, for the coming decades of our livestock industry, would be produce high-quality food in an ethical, environmentally friendly, and economically viable manner. And the commitment to sustainability is essential to foster resilience, as I said on my first slide, resilience and long-term success of the livestock industry. Thank you very much.
Thank you very much, Dr. Elke. Let's give a round again of applause, please. Thank you. And I would like to ask Dr. Posadas if you can deliver the present for the Dr. Elke, please. Thank you very much. Thank you. So we have some minutes for the next presentation. The next one will start at 11:45. So I want to remind you, if you can set your cell phone on to silent mode, please. And before the next presentation is here, Camilo Cabra. Sorry, the next speaker is here. Dr. Camilo. Yeah, I know, but we have, if you can go please with our staff, I think it's a little problem with the presentation. Thank you very much. So the next presentation will start 11:45. So, thank you. In a few minutes, 7 minutes. If you have some question from to Dr. Elke, maybe in the outside or by email, she will be here with us during all the Congress. Thank you. Okay, thank you very much again. Our next conference is what is the effect? Is it ready the presentation? Ok. No. Y el micrófono está apagado. Perfecto. Okay. Our next presentation is what is the effect of consuming dairy products and beef on the climate by Frank van Eerdenburg from Netherlands. Thank you very much.
Thank you very much, Ulysses, for the introduction and the organization for giving me the opportunity to present my talk here today. And I will give you the answer to this question. And what's the effect on the climate? It's zero. Absolutely zero. Nothing. And a lot of people won't believe me, especially these days in the Netherlands. If you hear people on TV, they tell you, yes, you eat meat, you drink milk, you eat cheese, you're very bad, you're a climate criminal doing that. Because these cows, they exhale a lot of carbon dioxide and methane, and therefore they're very bad for the environment, for the climate especially. And I don't deny climate change, because it's there. You can see that in the weather. In the Netherlands now, we have flooding because of climate change. The basic central key element in the greenhouse gases discussion and in climate change is carbon dioxide. It's in the air. It has been in the air for as long as the Earth exists. And it's always there, and it is there, and it's a healthy component of nature, because it is providing carbon to the plants. But the exhaling of carbon dioxide into the air causes the Earth to warm up. So we get a warmer climate, and we get climate change because of carbon dioxide. And of course, cows exhale carbon dioxide. We all exhale, we all emit carbon dioxide right now. Everybody of us here is exhaling, is emitting carbon dioxide. So we all contribute to climate change right now. You don't realize, but you're sitting there, you're destroying our climate by breathing. Don't you realize? You didn't realize that, right? And you too, you are a climate criminal. You should be put into jail. But then lock the doors without any air coming in, so you finally die. People say that a cow emits more carbon dioxide than a Hummer, than a Humvee. But is this important that it emits more carbon dioxide than a Humvee? No, the point is, where does this Humvee get his carbon from? The cow gets it from grass, but this guy gets it from fossil fuels, and that's the problem. Because the cow gets it from plants, and plants are, well, taking the carbon out of the air from the carbon dioxide. They split it up into oxygen and carbon. The carbon is stored in the plant. The cow eats the carbon, digests it, and emits carbon dioxide and also methane. And the methane then is converted into carbon dioxide, again, with this chemical process. And the point is that this process takes a lot of time, and that is several years. And until now, it was assumed that this process took decades. But the most recent report from the IPCC, the Intergovernmental Panel on Climate Change, says that that methane is 5 times less potent, so it is converted 5 times more rapidly than was assumed, and therefore methane is not such a bad greenhouse gas as was assumed. So the methane production of the cows is not as bad as everybody thought. Furthermore, we have, well, this morning there was a talk, and tomorrow and the day after tomorrow there will be talks about how to reduce the methane emissions in cows, and it can be reduced up to 40%. And that's a lot. So it's not that bad, that methane. You can use it if you digest the manure. You can use it to cook your dinner on. So to cook your steaks from the cow with the production, the gas production of the cow. It's a very useful animal, you'll see. But it's carbon dioxide which is in a short cycle in the pasture, because this grass that the cow eats, the carbon in there can be stored 2 hours ago or 3 hours ago or 3 weeks ago, but not millions of years, which is the carbon used in fossil fuels. And that's what the carbon used by the Hummer or by the industry. So you see here a lot of carbon dioxide being emitted, but this is from fossil fuels, and therefore it is bad for the environment, because this is not a short cycle, this is a long cycle. This carbon has been stored underneath the earth for millions of years, 50, 60 millions of years. The short cycle used by the cattle is converting carbon together with oxygen into carbon dioxide through the cow, and also methane, and it's split up. So this is the short cycle, as we call it. But what happens if the cow doesn't eat the grass? Have you ever thought of that? You could say, okay, let's get rid of all the cows. There's a politician in the Netherlands that says we have to reduce our number of cattle with 50% at least. What if we do just get rid of all the cows? Just get them out. Those dirty cows, they emit carbon dioxide. Get rid of them. What will happen with the grass? How many kilograms of grass did you eat today and yesterday? I can tell you, 0. No, none. You didn't eat any grass, because we cannot digest grass. So we need cattle to digest the grass. And if it's not digested, not eaten by the cow, it just dies. And what happens? It is composted in carbon dioxide and methane. It's exactly the same thing as what the cow emits. So what is the result of skipping the cow? Nothing. So what is the cow doing? Nothing. And especially if it is in wetlands, our environmental concerned people like a lot of wetlands, because it's good for biodiversity, they say, but it's also good for producing a lot of methane, because then the grass gets underneath the water and it doesn't have any air, and when it doesn't have any air, it produces methane, lots of methane. We call it swamp gas, and in the swamps you can see it bubbling up, and it's all methane. Hip hip hooray for the wetlands. But grass, if we can eat the grass, then it's no problem. But we cannot eat grass. We need cattle to do that. And do you realize how important grass is in feeding the world? We are about 8 billion people very soon, and we need to feed them. We need arable land for that, and arable land which only grows, where only grass can be grown, for example, is the Pampas, the Pampa area in South America, which is 800,000 square kilometers, which is huge. And you can see it here. These are pictures from the Pampas, and there only grows grass and a couple of trees maybe, but no grain, no corn. It's impossible to grow there. Just grass. What are we going to do with that without the cows? Are you going to eat it? No, I'm not either. So we lose all that arable land, and not only in South America, but also in the Netherlands, which is a very wet country, as you can see. We have a lot of grassland and peat soil, and there's only growing grass there. It's 30% of our arable land is grassland. No corn, nothing. No cereals, nothing you can grow there, only grass. And you need the cows and sheep to convert that into something useful for us. So I say thank you at the end of my talk to you for listening, and thank you very, very much to the cows for providing us with the last slide of the previous speaker, all that milk and meat that we can eat. So thank you.
Thank you very much, Doctor. We have time for many questions.
Feel free to disagree with me.
Is there any question?
I won't eat you. Although I'm not a vegetarian, I won't eat you. I don't eat humans.
No? Somebody? Oh, yeah, one. Thank you.
Hi, thank you. Can you hear me?
Sorry, is the microphone.
Okay. Hi, thank you for this nice presentation. I'm Harry from Austria. My question is, people which are not in favor of cattle and our stuff, they often argument that we have to feed the humans, or human population is growing and we need more agriculture to feed them and less grassland for cows which are occupying the land. So what is your argument against that?
I have no argument against that. It's just the argument for me to say we need cows. Because, like I said, in the Pampas, that's 800,000 square kilometers. That's a lot of land. I've been there. It's huge. And nothing else will grow there. So you can only grow grass, and we cannot eat that. So you need somebody, or some animal, to convert that grass into food that we can eat. And the problem is that this happens not only there, but also in many other places in the world where only grass will grow. For example, in the Alps, you have high up the Alps, and there only grass will grow. You cannot grow corn there. You cannot grow wheat there. It just doesn't grow. But the cows can eat that grass and can convert it into milk and meat. And therefore, you need the cows to feed the world.
And also the soya bean for cows and not for humans.
Oh, that's something else. Yes, if you say we feed a lot of soybean protein to the cattle, yes, that's right. But I'm talking about grass-fed cattle, not grain-fed cattle. If I go to a restaurant and I see on the menu grain-fed steak, I don't eat the steak there. And especially if you go to, for example, if you go to California where you have the feedlots, that's a terrible way of keeping cattle anyway, but that's detrimental for the climate for sure, because then you feed the grains that we can eat to the cows, and that's not necessary. But you have to feed the grass to the cattle. We cannot eat the grass, and that's something a cow can, and she can convert it into something useful for us. So my plea is for feeding grass to the cattle, put the cattle out in the pasture and let them eat the grass. Like in Austria, in the Alps, you can have them up there. You cannot grow any wheat there, but the grass will grow. And don't feed them soy protein. First of all, to grow that soy in Brazil, you have to cut down a lot of trees. And that's very detrimental for the earth and for the conversion of carbon dioxide into carbon and oxygen again. They are the lungs of our planet. You cut them down, that's very stupid. But growing cattle, like in the Netherlands or in Mexico or in any place, especially the Pampas, it's just very good for the environment. And the contribution to climate change of cattle in that way is even less than zero, because it improves the situation. But it's zero. The contribution of cattle to climate change is zero. But also if they eat grains, if they are grain-fed, still in respect to climate change, their contribution is zero, because the grain is grown with carbon dioxide and fertilizer from other origins. And if the grain is not eaten by us or by anybody else, it will be converted, will be composted into carbon dioxide as well. So that's the same story. So the contribution to climate change is zilch. It's nothing, except for the soya feed, the soybeans, because the soybeans, you have to cut down the lungs of our earth, and that's very stupid, but that's obvious. But that's a different story. Any idea how you would grow any grain without fertilizer? Why are we keeping cattle in the first place? We started keeping cattle thousands and thousands of years to produce manure, to produce fertilizer, to grow grain, to eat it ourselves. And these days, manure production of cattle is certainly in the Netherlands a huge problem, but we started having cattle and sheep to produce manure. They're the manure producers. And if you produce fertilizer, artificial fertilizer, you produce also a lot, you emit an enormous amount of carbon dioxide into the air. So cows are good fertilizers as well for the air. Thank you for the cows. You have a question?
Thank you, Katrina from Denmark. I just have a comment on your carbon-genic cycle here. As much as I like the cyclicity of our animals, we must admit that having methane in the atmosphere will still create the heat that we are trying to avoid now. And if we all agree on the COP28 goals and we need to reduce the heat, then we also need to reduce the methane in the atmosphere to cool down the earth. So even though I would like to keep my job and I would like to keep all of our livestock, we are a part of the solution. And sitting down saying that this cyclicity doesn't have any impact on the planet at all, I think is naive. I think this is a tool, and this is something that we as veterinarians can use to better our wealth and to better our job and our producers' way of life. And I think it's crucial to us that we take up that discussion and move up in front, saying that we will be a part of the solution and not just sitting down saying the grassland or the wetlands will do the exact same problem. So I disagree with your angle here.
Like I said, you're free to disagree with me. And as a matter of fact, I like your remark, because that's one of the things the COP the IPCC said before, that it would be they're all estimations because nobody really measured it until recently. And it appeared that methane is not as bad as it was assumed for decades. And in all the models and calculations, they use the old conversion time of methane, which is a lot shorter. Plus, that if you don't eat or don't have the grass eaten by a cow, it is converted into methane anyway. And we cannot, as veterinarians, we cannot do anything about that. But we can do something about the methane production by cows, because you can reduce it by 40% if you use certain feed additives, etc. It's discussed in other talks, so I won't go into details about that. But you can reduce the methane emissions from cattle enormously. And that's something I think we as veterinarians, cattle veterinarians, should emphasize and push farmers to do that, because methane is bad. That's obvious. It is a greenhouse gas and it makes the earth warmer, that's clear. But it's not the cow only that produced methane. There's lots of other ways of producing methane. The permafrost, which is thawing now in Siberia, emits an enormous amount of methane. You cannot even think of how much methane that is.
Oh, sorry, we don't have more time.
You don't have more time?
No. Sorry.
Okay,
but
thank you very much.
If you want to add something, maybe outside. Thank you very much. Thank you. Sorry, we have on time. It's just to be coordinated with the program. So the next speaker is Dr. Camilo Cabra, with the title of the presentation, Ultrasound Made Simple, How to Diagnose Abdominal and Thoracic Diseases with the Transrectal Probe, the Bovine Abdominal Thoracical Ultrasound Method. ¿Sale? By Colombia. Thank you.
Hey, hi everybody. I'm very happy to see a lot of people right here, and I hope this presentation will be very useful for you in the future when you will in front of a cow. So it's an honor for me to present to you the summary of my professional life and how I have been using the transrectal linear probe to diagnose hidden diseases in cows. The name of this presentation will be How to Diagnose Abdominal and Thoracic Diseases with a Transrectal Probe, the BovATUS method. First of all, let's travel from my little town located in the center of Colombia. Colombia is in the north of South America, to here, Cancun, in Mexico. Colombia is a country with beautiful landscapes and obviously very nice cows. Our milk production systems is based on pastures. Let's start. Maybe you can recognize this type of call when a client asks you, in my case, Dr. Camilo, could you help me? I think my cow is sick. Okay, what's happening? You answer, I'm not sure. She just looks sad, just not normal. And especially with the phrase, should just look sad, is when our minds get shocked. And all the information that we have received during the training at the university come to our minds. The same information that I recorded in, the same information that I recorded in books and all the database that we know on internet. And if we add to that situation that today is Sunday, we are 2 hours away by driving. That is something very common, at least in my country. But we are still looking for the answer because we want to help our client, obviously the animal. We may follow these 4 steps. Ask again, trying to find more information. Ask for the history. And ask again and again, trying to find forbidden or hidden data. But after finish the 3rd step, we don't find the answer. So we may follow to the last step, that is go to the farm and drive for 2 hours. Once we arrive at the farm, we observe the cow. We do the classical clinical exam, and we use the tools that a bovine veterinarian has. And after spending 10 to 15 minutes, we don't find anything striking. And immediately the client asks you, okay, doctor, what do you think? And you answer, below low body condition score, anything relevant? And again, with a nervous smile, you answer, everything looks normal, but the cow is still sick. And at that precise moment, you remember and you ask yourself that, and you make a question to yourself, and if I could see inside the cow, and you remember that you have in your machine, that you have in your truck a machine that you use daily on reproduction, and you wonder if that machine, if you can use it to diagnose other diseases in other organs, and you realize that there are other vets, especially with other species and also humans, who utilize that diagnostic method. So you said to yourself, you answer, okay, let's do this. But before everything, we have to ask ourselves these 3 questions. Why to utilize this type of exam? What to scan and how to perform the technique? To answer the why is because the first, you can't find the cause of the disease. After doing the clinical exam, you can't find it. You have the machine, obviously. You want to be a better doctor. Repro is not everything in our lives. You want to help the animal and the farmer. You understand the business, how the business is running. You want to have the farmer's trust. That is the most important thing in our career. What to scan? I'm showing to you a list of organs that you can scan with that type of probe, and even more. Basically, all that moves. How to perform the scan, the technique. So there are some books that show you the technique and how it's done. The first two books that I'm showing right here are the Veterinary Clinics of North America of 2009 and 2016 that I strongly recommend. The third book is the Dr. Buzinski's book that I, again, strongly recommend to you because it has beautiful pictures, beautiful representations. And the last book is a repro book, the Ruminant and Camelid Reproductive Ultrasonography, written by Dr. Coloton and Dr. Ginemi as co-authors. And it's a beautiful book because it has the basics of the ultrasound understandings that will be very useful to know what is happening into the cow. But now I'm going to show you very briefly, obviously, because we don't have too much time, the method that I developed for the last 14 years, the BovATUS method. We can use the linear transrectal probe that we think is only useful to scan a pair of ovaries and one uterus. You don't need to buy a new machine. Let's see how we do this thing. So the method has an order. We are going to start from the left side and after that going to the right side. Why we decided to start in the left side? Because in the left side is the rumen occupying the majority of the abdomen, so fewer organs will be scanned right there. The scan will be very quick. And why to start in the thorax? Because pneumonia is the most prevalent disease in my private practice in adult dairy cows. So the order is thorax, reticulorumen abomination region. And in the right side, we're spending more time to take more details. Again, the thorax, the pylorus abomination region, the small and large intestine, the liver, and finally the right kidney. But first, we have to know that we have to adjust three basic settings. The gain, increase the gain as much as possible, but without damaging the image quality. That's very important. Depth, set the maximum depth available to imagine that normally for those transrectal probes is 12 centimeters. And frequency, set the lowest frequency available. Maybe you have noticed that when you put your probe on the skin of the cow, you don't see anything. And that's because we need a coupling medium. So you have in this moment two options. You can clip the hair of the cow, that with this method you have to clip the whole cow, and use ultrasound gel. It may take some minutes. But the second option, that is the option that I use, is to use 70% isopropylic alcohol as a coupling medium. So let's start in the left side. You are looking at the landmarks of the lung or the thorax of an adult dairy cow. And you have to remember, because the lung is filled with air, you are not going to see the lung parenchyma. So the reverberation artifact that is this repetition of lines we'll see in a healthy lung. This white line is the visceral pleura that should slide smoothly. And this is how the scan is done. So apply the alcohol. My recommendation is always put the tip of the probe facing dorsally, scanning the intercostal spaces from cranial to caudal and from dorsal to ventral. Watch my hands movement. This is how we done in adult dairy cows. If you want to scan the cranial part of the thorax, that usually is difficult, you have to obviously apply the alcohol right there and put a lot of pressure, as much as you can, to watch the cranial part of the thorax. The most important abnormal findings, and obviously there are a lot of more, are lung consolidations, acute respiratory distress syndrome, and pleural effusions that is very related in a place where I live in high the mountains with heart diseases. That's very common. The second region that is very important is the reticulorumen abomination region. 30% of the time when you scan this place, you are going to see the reticulum-rumen junction. The other time, you are going to see the abomination with the reticulum or the rumen. You have to stop there and watch for the contractions. That should be obviously bimodal, as you know. You have to remember again that because those organs are filled with gas and content, you are going to see just the border of the organ. Sometimes the omentum comes into the picture. You don't want to be confused with fibrin. Take care, be careful. And this is how the scan is done. So this is the place where you have to put the probe. One recommendation, there are a lot of cows who are very nervous when you touch them right there. The recommendation is, because you don't want to be kickies, set the sprayer in the street mode, apply some alcohol just to warm the cow. The other recommendation is put the tip of the probe facing cranially. You will always see the reticulum that should be pointy in the same place. The most important abnormal finding in that part is the hardware disease. So you'll see fibrin, fluid, and sometimes you will see abscesses. Going to the right side, we are not going to repeat again the thorax. So we are going to go to the second place, that is the pylorus and the abomasum region. So the pylorus, you can see the pylorus in the right and in the left. The pylorus, you will see a half moon shape with shadow artifacts due to the thick muscle that it has. It's very mobile, so you have to look for it in this place. The abomasum is different from the other pre-stomachs because you will see the echogenic content, and you will see thin wall and thin folds. And this is how the scan is done, the place where you have to put your probe. So be careful, because some cows, again, are very nervous when you touch them right there. This is the pylorus, you have to look for it. In this place, we found the pylorus in that place. The most important and normal finding in that place is obviously the displaced abomasum that could be to the right or to the left. You know that this disease is very easy to diagnose with an stethoscope, but sometimes, especially in the right side, some doubts exist. So to clarify that the diagnose or the organ who is causing the ping sound, you can put your probe right there, and if you see the content and the folds, you will confirm your diagnosis. Another pathology that you will see there is the abomasum lymphoma, that you will see very thick walls. Going to the small intestine, you're gonna see the small intestine in these blue regions, but these three red circles or spots is the most important or prevalent sites that I have seen with the lesions in that region. So you will see cross sections, angle edges, cross-section loops, angle edges, content from edge to edge, and constantly contractions. And this is how the scan is done. Again, apply the alcohol and watch for, and put the probe in those three regions. You will see something very similar to this in a healthy dairy cow. The most important and normal finding in the small intestine is the small intestine accidents, obviously. So you'll see, excuse me. You'll see increase in loops or bowel diameter, a lot. You will see fluid between the loops. Another thing that is very common to see is decreased or absent contraction. You can see that the content is moving, but the intestine is not contracting. Going to the liver, you will scan the liver in the last intercostal spaces. So you have to be careful, because there is a part of the liver that is very cranially. You don't want to be confused with lung consolidation. So the liver is a very homogeneous organ. It's gray. That has a lot of vessels. Usually you will see the portal vein in number 1. You won't be able to see the caudal vena cava, because that probe doesn't allow us to go very deep, and the gallbladder is in number 2. And this is how the scan is done. In this moment, we are going to increase the gain to its maximum allowed by the machine, because we want to improve the image of the deeper zone, because this organ is very big. So apply the alcohol right there. And this is the condition where how we work right there. And you will see the liver with its vessel. This vessel is a portal vein, and you have to remember that portal vessels has echogenic walls. The most important and normal findings in that organ are the diffuse hepatic disease that is very related with nutritional poisoning, that is very important in our place. Liver abscesses, there are a lot of sizes and amounts of liver abscesses. Fasciola hepatica, you will find sometimes, that is this case, you will find a cyst with the liver or the fluke floating right there. Finally, we are going to speak about the right kidney. So this is the landmark of the right kidney. So it will be almost impossible to see the right kidney in just one picture. You have to move your probe to scan the whole kidney. The left kidney should be scanned via transrectally, because it's in the middle of the body of the cow. And this is the place where you are going to see the right kidney. Sometimes it's really uncomfortable to put the probe right there. So you have to adjust and make it easy. The most important and normal finding in the kidney are incidental findings, at least in my experience. So you will see renal cysts that could be single or multiple, like this case. And I show you, this is not a percutaneous ultrasonography, it's a transrectal ultrasonography that is very common in the place where I live. Find cows who has red urine, and you will find bladder neoplasm. As final consideration, you have to remember that fat cows, because the thick of the wall and the fat will cause you a lot of difficulties. So you can upgrade to watch the organs. You can upgrade the isopropylic alcohol to 100%. It will improve the image quality, but it will be not perfect. Be very careful with nervous cows. You can sedate them with xylazine, but you have to know that you will alter the small intestine, because you will cause ileus. Protect your machine. In BRD cases, outbreaks, analyze all the data, not just the ultrasound data. Ultrasound artifacts tell you a lot. If you don't have the knowledge to analyze that information, I recommend to you to study it before. Try to find the same lesion in different positions. Sometimes you find something that it appears not normal, so just move your proof, and if you find that thing, it may be real. Always make a relation between the clinical exam and the findings. This is very important, because sometimes ultrasonographers forget that the cow is alive. You have to make the relationship between the findings and the cow, the clinical exam. And obviously, take your time, especially when you are at the beginning. As a take-home message, ultrasonography is a tool that you can use, but it's not the only one. But if you use the BovATUS method, and if you are in that situation that today is Sunday, there is no live, you are very, very far away, you have to go to the farm, and you have to answer the question of the cow is up, because you have to, especially in the countries where we live, where the farmers are very small. You will make better decisions. You will make a better prognosis. You don't want to spend money in something that won't solve the problem. And you will save a lot of time. You can perform a complete thorax and abdominal exam in an adult dairy cow in less than 9 minutes. Finally, I want to say thank you to my dad, Rafael, my sister, Margarita, and my mom, Lucero, my beloved wife, Claudia, the future, I think, veterinarian, my daughter, Maria Jose, and obviously to my teachers, From left to the right, Dr. Dr. Businski, Dr. Inemi, Dr. Coloton, Dr. Olivet, and obviously to my clients and their cows who allowed me to develop this method the last years. And I have to say gracias, and I will be more than happy to answer any question. I think that I have 30 seconds.
Thank you very much. Yeah. Maybe we have time just for one very short question and very short answer. But very, very short. And if Dr. Dario can prepare, please.
I'm Bernd, practitioner from the Netherlands. I'm not sure next week I will remember all your nice pictures and movies, so I was wondering what's your YouTube channel, so I can watch it again, because I really like your presentation and will help, I think, a lot of the practitioners here to do a better diagnosis. So thank you very much.
Okay, you're welcome. So, yes, I just forget to say that I have a YouTube channel. Most of the time is in Spanish, obviously, but you can use closed captions. So, and we share information of, obviously, there are a lot of diseases and pathologies that we can diagnose with the transrectal probe on Instagram and in YouTube. Really those both things. Thank you. Thank you.
Okay, 20 seconds, doctor, please.
Buenos días, un comentario, disculpen, a lo mejor muy insignificante. No nos olvidemos que la producción ganadera empieza de los pastos. Los granos son importantes, yo los uso exageradamente, pero cuando me concentré en los pastos nativos de mi rancho, se me solucionaron muchos problemas. Seguí dando granos, seguí haciendo todo lo igual, pero cuando le puse atención a los granos que florecieran, se me acabaron muchos problemas de enfermedades, etc. Es un comentario insignificante, con todo respeto para todos ustedes.
Thank you, doctor. Okay. Our next speaker is Dr. Darío Antonio Vallejo Timarán. He's from Colombia, and the presentation is clinical and cytological evaluation of the cervix in relation to the estrous cycle in grazing dairy cows from high-altitude tropical herds in a pasture-based systems. Thank you very much, doctor.
Okay, thank you very much. Nice to meet you. Okay. So we're talking today about clinical and cytological examination of the cervix. My name is Darío Vallejo, coming from Colombia, from the AgroSavia. It's the Corporation of Agricultural Research in Colombia. Okay, we're talking today about cervicitis. It's an interesting problem and how it is related with proestrus specifically. Okay, so first one, I'm talking about a little bit about grazing dairy cows from high tropic herds. This is typical from our country. Okay, what is some characteristics that we need to know? First, we have consecutive seasons, winter, summer, raining and dry season. It's common in our country, and this is difficult for grazing. It's difficult to growing of the pasture. We have rotational grazing in the street, but we don't have a consumption calculation. This is a big trouble for us because it's not common in the farmers. In the same way, the forage have a high nitron, no protein nitrogen, low in energy, and high nitrogenous fertilization. As a consequence, despite we are in the tropics and despite we have the capability to produce grazing, we have limited access to grass, low energy on the diet, and high nitrogenous content in this diet. As a consequence, we have a big problems with dietary requirements. Other problem is that we have a bigger increment of milk yield increase due to genetics, due to embryo transfer to EATF, and we produce milk at an altitude to 2,200 until 3,800 meters with low disponibility of oxygen, long trials from paddock to the milking room in mountain areas with undulant topography, and high solar radiation, high relative humidity. It means that we have a bigger problem related with energy in the diet. The farmers try to make a solution, proper high volume of dietary supplements, no fractionated, because these supplements are offered only in the milking 2 times a day, and no transition period. Transition period is not a common practice in our country. This is the context general. We have difficulty to provide a balanced diet, and for this reason, head stress, subclinical hypocalcemia, metabolic stress, low ruminal pH, and hypoglycemia, hyperketonemia. It's a common problem in our country, our diagnosis, and related with fertility. On the other hand, we know that postpartum, the contamination of the uterus without the presence of the infection is a common problem after parity. And the normal uterine involution is a process that takes normally 40 days. However, conditions of the high tropics that I previously mentioned, hair management, calving problems, and metabolic alteration are related with imbalance of bacteria that contaminate the uterus. As a consequence, we have 2 common problems: excessive inflammation related with clinical problems, and inadequate immunological response related with subclinical problems. And this is known in all the world, worldwide. We have a purulent vaginal discharge with cytological endometritis. This is the clinical typical problem, okay? Purulent vaginal discharge located in the uterus, clinical endometritis. And on the other hand, we have the subclinical problem. No purulent vaginal discharge, but with no cytological endometritis. No purulent vaginal discharge with cytological endometritis. This is a repeat breeder cow, okay? That we don't have clinical things, evident clinical things, but this cow don't get pregnant easily because have a subclinical problem, okay? But some years ago we found we start to find this report, a cows with purulent vaginal discharge but with no cytological endometritis. It means that this discharge not coming from the endometriums, coming from the other place different from the uterus, and probably cervicitis and vaginitis start a problem that could be related with fertility. Small information there is worldwide about how cervicitis can interact with another disease. It's not a common publishing information. In Colombia, we know that postpartum uterine disease is common. We have different profiles how the disease occurring, metritis, clinical endometritis with cytological endometritis, both of them, and all of them affecting fertility. But in the last years, we found cervicitis too. Interesting here, we found clinical cervicitis, diagnosis by vaginoscopy, in almost 50% of the cows, but when we performing cytological examination, we found only 21% of the cows with this problem. This poor agreement between clinical and cytological cervicitis start to generate some doubts. And this is the objective. We start to perform a clinical cytological evaluation of the cervix in relation with the proestrus. The hypothesis is that for the diagnosis of cervicitis in grazing dairy cows, there is a correlation between proestrus and clinical cytological findings of the cervix. Shortly, probably normal change of the proestrus could be related with the diagnosis of cervicitis, and it's probably sober diagnosis. We false positive in the diagnosis of cervicitis, and we try to contrast these findings. The sample size that we use, for now, 18 observation. We use a case crossover design. In this design, the cows acting as a case in the proestrus, but the same cows acting as a control, evaluating in other time different than proestrus. This kind of design helps us to reduce bias and to reduce confounding related with cows specifically change. And we use cows from the research of the Ubuntu Research Center in Pasto, coming from the AgroSaudia. We use postpartum lactating dairy cows, Kiwi cross, and these days in milk. We exclude cows with calving problems, clinical symptom systemic disease, reproductive problems. This is the design that we use. We're selecting cows in this range of postpartum, days in milk. And we use this design. And day 0, we start in a synchro protocol, okay? And it's in this point we use control moment, cows that cause a no moment different to proestrus. We're performing reproductive exams, cytological sampling, and blood sampling. Continuing with the protocol and the DNA, we assuming that probably we are in the proestrus, and we evaluate the cows, the same cows, in a case moment. We're performing reproductive exam, okay? Palpation, ultrasound, vaginoscopy, and cervix endoscopy, okay? Cytological and cervical endometrium examination, and blood collection from the determination of progesterone and blood, serum progesterone. And after that, we perform an examination and pregnancy diagnosis. This is the case definition. We use the definition of Harman by vaginoscopy, grade 0, 1, or 2, and congested cervical mucosa, no protection of cervix, second cervical ring. Grade 1 is congested mucosa, but no protrusion of cervical ring, and grade 2 is congested cervical mucosa with protrusion of the second cervical ring. We confirm the diagnosis with we confirm this diagnosis of clinical cervicitis with cytology with this point, or cutoff point. The data analysis, descriptive, and we're performing a different analysis. We use impregnating rates to define the point, finally point to define if really we have problem with cervix or not. As a result, we have preliminary results. We added the analysis of the information now. What we found, this is proestrus group, and this is non-proestrus group. Interestingly, we found 47% of the cause diagnosis with cervicitis in proestrus group, and we found only 30% of cause diagnosis with cervicitis in a time different through proestrus. In addition, 35% of the cervicitis cows had normal cytological exam and got pregnant, okay? And in the other hand, in non-proestrus group, 30% of the cervicitis cows had normal cytological exam and got pregnant. It means that the real diagnosis of cervicitis in proestrus was 32%. We have a false positive of 15%. And in a time different, another time different than proestrus, we have 25%. The false positive in this case was only 5%. This is the diagnosis that we're performing with vaginoscopy. Okay, this is grade 0. You can observe a mucosa that is not congested, okay, no protrusion. This grade 1, congested but without protrusion. And grade 2, congested mucosa and with protrusion of the second cervical ring, okay? This is the clinical diagnosis. Now we are starting to plus to the diagnosis cytological examination. And this is interesting. This is some additional unknown change that we found in the cervix endoscopy, that it could be related probably with inflammatory condition. For example, we start to find in necrotic areas or located congested areas, okay? That is not described now, but we start to try to organize this change and try to define if really have some relation with fertility or some relation with the progression of the disease. Okay, we know now that cervicitis are related with clinical endometritis, increase the risk of clinical endometritis. This is important for us. And we start to use this tool to refine the diagnosis. As a conclusion general for now, according to preliminary results, change in the cervix related with cervicitis grade 2 of causing proestrus or estrus may be related with change associated with head and not with inflammatory change, okay? And the use of vaginoscopy, endoscopy, and cytological exam, considering the design of the estrocyte, can increase the reliability of the diagnosis of clinical cervicitis, favoring the implementation of therapeutic protocols, prevention measures, and improve the fertility. As a general conclusion, we now try to start to diagnose cervicitis or try to start to evaluate the cervix, considering the time of the estrous cycle, mainly proestrus, okay? We start to find a big number of false positive, and this is important mainly in clinical process, but too in research, because we start to work in a lot of in the line of what happened with cervicitis in direct cause, okay? What happened, is really a big problem or not? This Friday, I have another conference about the results related with cervicitis and fertility, and cervicitis and the relationship with another postpartum uterine disease, and we found interesting results. For this reason, it's important to start to refine this diagnosis. Okay, thank you very much. I appreciate your questions.
Okay, thank you. Thank you very much, Dr. Dario. I have 4 minutes for questions. Somebody, please. Okay, yeah, you can come.
Hi, hello, I'm Harry from Austria. My question is related to the method of diagnosis of cervicitis. So you only assumed the shape or the shape of the mucous membrane, so the prolapse. But did you also check for diameter of the cervix by transrectal palpation or by transrectal ultrasonography, or also included the vaginal discharge? So cervicitis is often associated with it. So if you include those parameters, you may have a higher accuracy of cervicitis diagnosis.
Okay, thank you very much for your question. Really, yes. When we perform this kind of diagnosis, we use both of them. We use the diameter, okay, to try to define if probably there is or not inflammation. For clinical process, the discharge is so important, okay? For this research, we exclude cause with clinical process, okay? Because when we found cause with cervicitis and vaginal discharge, we define if this discharge is coming from the uterus. We confirm with the ultrasound, okay? If this discharge is in the uterus, we exclude of the study because this cause was diagnosed as endometritis, clinical endometritis cause. What is the problem? The final point of our research was the pregnancy. And if we include the cause with clinical disease, such as clinical endometritis, we have a false positive, or we have a cesgus here. We have that, and for us, if we include this kind of cause, we can define if really pregnancy due from cervicitis or not. Okay, this is the deal in this research. If we include a clinical disease cause, we don't have the possibility to define if the pregnancy or not pregnancy is due the clinical endometritis or is due cervicitis. For this reason, we exclude this kind of cause. However, in the diagnosis, general and clinical process, we need to use this kind of tools. We need to define the diameter. Obviously, we need to take into account the number, the parity of the code. And we need to revise, we need to observe the mucus. And if this grade 0, is the flocculus or pus or grade 2 or not. This is so important in the clinical general diagnosis, obviously.
Okay, thank you.
Okay,
the next question, please.
Okay, I am speaking Spanish. My question is in Spanish. Okay.
No hay problema.
Okay. No problem.
No problem.
Ok, mi pregunta va referente a el protocolo que se realizó en estas vacas, en qué momento, días posparto se hizo el chequeo y específicamente el procedimiento para la citología, si fue citología cervical o fue una citología endometrial. Excelente. Y qué parámetros se tomaron para valorar si era una citología positiva o era negativa. ¿Cuántos polimorfonucleares tomaron como parámetro base?
Sorry,
Okay.
Dr. Dario, can you please translate a little bit the question? For
Yes.
all the
Sorry, your name? Freddy Escalona asking about the technique to diagnosis the cytological exam, if you use a Fernex or if we use endometrius, and what is the percentage of neutrophils that we use to diagnose the cervicitis. Okay, perfect.
Thank you, doctor.
And another little bit question about the protocol. Is really or not? Okay. Okay, it's the protocol. Okay, perfect. So to respond this question, we performing two diagnoses. First one is the cervical diagnosis. We have two ways. We can use the Fernex, okay, that in that case is difficult to talking about cervicitis because probably could be vaginitis. For this reason, we always put the cytobruch in the first cervical ring, okay? So we couple the cytobruch. The cytobruch is cutting and is coupled to insemination tool, okay? And we use the tool as if you will be to inseminate the cow, okay? Locate the cervix by palpation, introduce the tool, and when you locate the cervix, introduce the point of the insemination magnum in the first cervical ring, explore the cytobruch, and take the sample. And for the endometrial, obviously, you cross the cervix and use the body of the uterus for endometrial diagnosis. Okay, this is the protocol exactly. We use a 5% as a point, a cutoff point to diagnosis endometritis, and 8% as a cutoff point to diagnose cervicitis. But this is so important to consider because the cutoff point is important in this disease because you found sometimes cows with 5% of full coin and you say, oh, hey, it's subclinical endometritis and the cow got pregnant. Okay, so you need to be careful with that. For the diagnosis of endometritis, subclinical endometritis, you need to have 5% or more of neutrophils in the strain, in the cytological examination, plus repeat breeder cow. In that case, you can talking about subclinical endometritis. However, in the otherwise, you only say cytological endometritis, okay? It's the same from the cervix. From the cervix, you're talking about more than 8% because we found that 5% is related with more probability of pregnant cows. So it means that probably you need to increase the cutoff point to try to diagnose this kind of cows. So for this reason, you increase a little bit the cutoff point. But for now, we're starting to research what happened with that. We need to know what is the exactly cutoff point for cervicitis. Because main research in subclinical endometritis help us to know that 5% is the magic number, okay? But not for cervicitis. For now, we're starting to work about that.
Okay, thank you very much. Give up a round of applause, please.
Thank you very much.
Thank you. Thank you, doctor. So our next speaker is the Dr. René Rosiles Martinez with the title Micro Minerals, Elements, Behavior in Cows Transition Period. He's from Mexico. Thank you very much, doctor. Este es el señalador, doctor, para adelante, para atrás, y este es el del láser.
Well, thanks for allowing me to come to talk to you today. I appreciate the organizers of this meeting, the facilities gave to us. But one more point that I like to stress up is that among these results, there is a few students that work and help us. So anyone in this, or no one in this talk has referred to the academic point of all this meeting. So I appreciate the help of all the students who came over and gave us a hand. Well, you don't have to read all these letters. The point that I want to stress up is that anytime we talk about the downer cow refers to the cow that lies on the ground. And that means that there is something that is not coming to help the cow to stand up. And we call that cow the downer cow, the one that lies on the ground. And in order to figure out the pathology of this situation is that the cow may have some troubles with the muscles. And we call it myasthenia, we call lack of calcium, and also one more thing that I may add is the anticholinergic alkaloids like tropin that make that cow to not keep a strong power for the muscles to keep her up. So once we had that cow in front of us, we wanted to analyze calcium, but some other mineral elements as well. It was phosphorus, it was potassium, it was sodium, and it was zinc. So we were already kind of thinking that something else besides the lack of calcium present in that cow will be something else. And those something else, we call them phosphorus toxicosis, a lack of zinc in order to have that titania and the increase of sodium and potassium. So those 5 or 4 more minerals elements will do something related to the capacity for that cow to do not keep staying up. Well, so variation of mineral elements in that donor cow was kind of something that will give us some information that something else besides the reducing of calcium will be present, and one of those were the ones that I already mentioned. So we have to think that something else is going on besides the lack of calcium. All we do whenever we have that animal in front of us is just to apply some calcium. Might do some help because calcium and phosphorus are antagonists when they are not in balance. Remember that the potassium that the cows will eat will get into the bloodstream, and that time either the potassium makes the hydrogen to get out of or to get out in the blood, so it will do some variation in the pH of the blood. So besides that lack of potassium, we may have some lack of zinc, we may have some different condition in the pH, and all those things have to be considered whenever we think the only we have in front of us is the reduction of calcium. So think about that and keep on so to have a really good, a complete diagnosis. Okay. Hypomagnesemia is another condition that goes along in that downy cow. So that lack of magnesium will do some neural alteration. So we have to think a bit about the lack of calcium and the lack of magnesium. They usually go together whenever the cow is on the ground. And that hypomagnesemia, as we can see here, the hypocalcemia and hypomagnesemia will break we block the kidney to filter and to make a parathormone responsive. So whenever this parathormone is not responsive, the lack of calcium will continue on. So all this analysis we wanted to do in the blood serum of that cow was to see what else was going on besides just the lack of reducing of calcium. In order to come out with these results, we do analyze with atomic absorption spectroscopy I want to say a few more things about that, an instrument, not because some company illustration, but this is something that really helps us for a lot of different things, to analyze for minerals in the blood serum of the cow, to analyze for different elements on the soil, to analyze for different elements on the field, on the grass. So it's really sounds helpful. And in order to have this thing going on, we come up and ask for some students, hey, come on, do the dishes, clean the floor, and help us to do these readings in the atomic absorption spectrometry. So that's the reason I want to mention about all the students that come on and help us to finish the work. But it's something that I wanted to stress out. These were some of the analysis we came up with. Well, this is good as well. See, this is the kind of good, for me it was not just the difference between the amounts, but the difference between the percentage of the concentration before and after the parturition of the cow. You will see here we have the 16% percentage of calcium before and after the parturition. Here we have the magnesium, the same situation, before and after the parturition. We do have here hypocalcemia, and we have here hypermagnesemia. Here we have, no, I'm sorry, these two are reduced. Sodium, the amounts of sodium before and after. In this case, in sodium, we have to think also about the sodium toxicosis, and that thing is pretty well related to water deprivation, especially this time where we are living here in this country, a lot of rain. These two reduced, and this was increased. So anytime we have some increase of sodium in blood, we think about sodium toxicosis. But besides that, reading the amount of sodium in the blood, we also find out what we call necrosis of the brain, but also with increase of eosinophilic cells and the peripheral of the vessels in the brains. So there's two things that we need in most of the cases to come together and emphasize emphasizing the diagnosis with the amount of sodium and also the tissue lesions. Here is the potassium, también reduced. Probably this is something that helps to control the pH in the blood. But this is the one that is much important for me to mention to you today, because we also see some reduction or increasing beneath or close to 10%. But see what the difference in pre and postpartum of phosphorus is. So for me, instead of calling sodium reduction, I'm going to call it today phosphorus toxicosis, because there's huge amount that you can see in this element. So there is something that has to be done in order to keep animals alive. Well, here is the main points. Hypocalcemia, I'm sorry. Oh yeah. How do I put this thing back? Okay, yeah. See, from one clinical sign of a cow that is lying on the ground, we advise to have some differential diagnosis as well. Okay, here it is. We had animal with some calcium reduction. We have an animal with a huge amount of phosphorus in the blood. We have also an increase of potassium. We have reduced the sodium, and we have reduced the magnesium. So it's not just the deficiency of calcium in us, the other modifications and the other mineral elements. So in order to keep this thing, in order to keep these animals in good health, we have to consider all these differences in the differential concentration of these elements. And what are we going to do in this point? Just to balance the feed of those cows in order to add them or take them away before they go to parturition. I'm pretty sure that this is something that has to be done, or it'll be good to do in order to keep these animals in good health, in order to keep them away from the cooling situation. Well, now we kind of finish up with those mineral elements. We were considering also differential diagnosis. What do I mean with differential diagnosis? Thinking that might be something else besides, in order to complete the analysis of that cow. This is one that we are pretty much interested in, polyencephalomalacia. We all know what polyencephalomalacia is, right? It refers to some necrosis in the brain. And this one as well, atropine toxicosis, that means that some animals was going to eat or was eating some of these plants. This Dahlia coccinea is really pretty much, well, right now is kind of cultivated, but some years ago, some months ago, it was called the Mexican plant, but it was pretty much used for some condition that some men or some people was using in order to cure some disease in people that they did not have any medical attention. So whatever this plant do in any people or in any animal who take this plant is atropine. What does atropine do? That compound, all it does is just to break the continuity of the stimulation, because this atropine is antagonist of acetylcholinal. So this point and the other ones on this kind of this I'm sorry, this compound breaks breaks the continuity of the stimuli, and this one not breaking the continuity of the stimulation, but we do the same clinical signs as this hypomagnesemia, this hypocalcemia and hyper. I'm sorry. Well, all I can refer is to the high amount of phosphorus. Instead of calling calcium deficiency, we don't have to, but it'll be good to consider it to have this condition as a hyper amount of phosphorus. In order to do something for these animals, instead of only adding calcium in the blood, we have to consider different antidotes. The one that goes against atropine, for instance, it will be physostigmine. The one that goes against botulinum will be, of course, the antitoxin. The one that goes for water supplementation used to have the water close to the man to have it ingest. And what is going to be with this vitamin B complex deficiency? Of course, giving some source of energy. Well, all I have here is some pictures of the different plants that have some I'm sorry. what does Brackenfern do? We call it a lecho macho, terium equilinum. Once a horse takes these plants, he will be suffering of some presence of blood in urine. And that means that horse may have some cancer, some tumors into the bladder, because once this compound, or once this plant is ingested, then maybe they may reproduce, or might be appearance kind of a cancer in the blood vessels. So that's the reason we do see animals that have eaten this fern having blood in the urine. But besides that, this plant also is anti-thiamine, okay? Has a lot of thiaminase. So this plant also, depending on the species, we will have different pathology. For instance, if it's a horse eat this plant, he will be suffering of a cancer in the bladder. If a cow will eat this plant, he will be suffering of thiaminase present. What does that thiaminase induce? It induces the polyencephalomalacia. So, okay, just 1 minute. Well, okay, I'll go faster. And this is the Quisetum nervensis, or horsetail as well. Well, this is going to be the last. This one makes me really kind of proud to show it to you. What do we have here? We do have here a slide of a brain having necrosis in the sul side of the circumvolutions. This is a pretty well indication of the effects of thiamine, or deficiency of thiamine, or the presence of thiaminase. We don't have to go over and make some analysis in the lab. All we have to do is just to put the brain into the fixative, and then after that, looking for this, for the presence of this necrosis, having just a UV lamp. And what are we going to do with this brain? Just to look at this kind of necrosis as well, thinking that might be something else, but this is something related to the presence of a mycotoxin. And here is this, you see all this kind of necrotic areas as well, and this is pretty well associated with the presence of the high ingestion of sodium, or some ingestion of lead as well. So my point is that once you see a cow lying on the ground, you have to think in all these possibilities in order to make a good diagnosis. Well, this is my last point. What's what you see here around? Use the chicken manure. And what do the people that clean the places of these animals, once he has some curses, they throw them to the manure. And you will see that these animals will once they decompose, then you will see a lot of worms moving around. Those animals are larvae of lice. Well, here is what we receive, and anytime we want to make that, or anytime we are called to make the diagnosis. Having this kind of samples, we'll see that there is a source of animal proteins in order to look for botulinum toxin. And all we did was to have the perfect conditions for the Clostridium and botulinum to grow and to produce the mycotoxin, the toxin. These are some pictures of the sarcophage flies that move around and fly around and take the larvae to a different place to contaminate some other types of feed. Well, these are some of the figures that we all will confuse. the lying animal on the ground, and might be clostridiasis, or might be botulism, or might be lack or reduce of calcium, or high quantities of phosphorus. Well, this is just to show where the acetylcholine and acetylcholinease are needed in order to move the reflex from one neuron to another. And this is the last. This is a mice that we inject with the with water extraction from those chicken manure, and was inoculated with intraperitonealia, and then we observe this kind of changes. All we see here is the thoraco-abdominal respiration that is pretty well indicative of the presence of botulinum toxin. I guess that's it. Oh, no, this is the last. I'm sorry. Here we have the flower of dahlia. This flower is pretty much used as ornamental flower here in Mexico. But all we found with this flower was the presence of atropine. Atropine is an alkaloid that fluoresces when illuminated with the UV light. And my point here is that most of the analysis we do for alkaloid analysis is the use of drug and reagent. We never thought might be something else or something other compounds that will react with the UV light. In this case, atropine is here. A lot of atropine in this thin layer chromatography. That is another compound, another alkaloid that will induce the same clinical signs as the downer cow. I guess that's it.
Thank you very much, Doctor. Of course, there are no time for questions. You want to talk with Dr. Rosiles, maybe outside. Thank you, Doctor. Our next speaker is Dr. Mike Kirby from United Kingdom, and the title of the conference is The Use of a Topical Rapid Drying Liquid Barrier Dressing Containing Copper Acetate and Zinc Chloride as a Treatment for Udder Cleft Dermatitis Lesions in Dairy Cattle in the UK. Thank you.
Hola, hello. And I just firstly like to thank the organising committee for accepting my paper, and more importantly, secondly, thanking you for all staying here after a long, informative morning when the call of lunch is pressing. So I am an ordinary cattle practitioner. I've been qualified 39 years, and I first came across Udder Cleft Dermatitis in our practice in the southwest of England about 30 years ago, but the incidence and prevalence was very low. And that coincided roughly with the appearance of mortellaro disease, digital dermatitis as we now call it. And so for many, many years I always thought that's what was primarily the cause of Udder Cleft dermatitis, particularly bearing in mind the close proximity to the affected hind feet when cows are lying down. Things have moved on, and certainly the presence of treponemes is equivocal in the etiology of Udder Cleft dermatitis. So, Udder Cleft dermatitis, also known as bovine ulcerative mammary dermatitis, udder fowl, udder rot, udder intertrigo. And it's becoming an increasingly recognised skin problem, mainly in dairy cows and predominantly in Holstein Friesians, affecting either the foreudder attachment with the ventral abdominal wall and or the skin between the two udder halves, but particularly between the cranial two quarters. And lesions vary from very mild erythema, small papules, through to pustules and crusts, but they don't seem to be in this phase very long at all and go accelerating into more severe lesions with varying amounts of skin being affected with open wounds, with a characteristic necrotic and malodorous odour, and then sort of layers of granulation tissue, pus and blood. And so this doesn't show up that well. This would be an open wound with some pustules and some crusts, which is a fairly typical first appearance when you're examining these areas of udders in herds that have got cases of more severe udder cleft dermatitis. This is a more advanced one. Sorry. And so this, just to orientate, is actually the fore attachment to the udder and then extension down in between the two front quarters. And this is a sort of worm's eye view going right up into the udder cleft itself, and a deep penetrating wound with a lot of moisture, really bad smell. And this is quite a rare sequela to udder cleft dermatitis, but it's the formation of a granuloma. And believe it or not, that is the front right teat and the udder attachment. And if we have time, we'll try and come back to that, and I'll leave it a thought with you just before lunch. So there have been two lesion scoring systems described, one by a group of Dutch workers under Van Werven, and one by some Swedish workers under Ekman. And the Dutch described score 1 with a mild lesion with erythema, transudate, crust and scabs. Score 2 with a more severe lesion with an open wound, but the critical bit here is the size, it being less than 5 centimetres by 5 centimetres, and score 3 with an open wound that's bigger than that. And then the scoring system was advanced by the Swedish study of Ekman and others, such that they divided it more into normal, very early stages, becoming more severe, but no open wound at this score of score 3, score 4 with a small open wound, and then pretty much what most of us who see it in practice are presented with, a severe score 5. Obviously, there's health and welfare implications. It's an open wound. It no doubt creates pain and discomfort, although most dairy cows seem to bear it pretty well. But there is undoubtedly evidence of inflammatory mediators going around and affecting higher centres of the brain, and therefore having other effects metabolically and on reproductive tract particularly. It may also increase the risk of clinical mastitis. And obviously practitioners in the audience will be very familiar with the invasive problem that you get called to as an acute emergency, where it's invaded a major blood vessel. And these things are extremely difficult to tie off, almost impossible in my experience. And so you do your best with cobbling things together with pressure bandages and sutures. But certainly in the UK over the last 6 years, there's becoming an increasing awareness of sudden death in adult dairy cows associated with severe UCD in the form of embolic pneumonia, where blood clots block off either the pulmonary artery and or the coronary artery, with obviously fatal effects. Scientific research into the treatment options, though, for udder cleft dermatitis in dairy cows is really, really scarce. And peer-reviewed research is even rarer. So just before I go into what we've started to try and treat UCD with, just go through the 3 treatments that I found in the literature. One using a human preparation for open bed sores, which was used in a Dutch study, again by Van Verven and his co-workers, who created the first lesion scoring system that I showed you, with a product called Alginagel, which is a mixture of all those things that are up there, and in the interest of time I won't read it out, but essentially it's an antimicrobial enzyme complex in a gel formation, and they applied it daily for 12 weeks, which is a huge treatment time. And I make no apologies for emphasizing that, because this condition is a long game in the treatment of. And they showed that with daily treatment using this product, that there was a 3.4 times more likelihood to improve, that's not heal, but just to improve compared with controlled, an untreated control group. And indeed, the total number of lesions that healed completely by the end of the 12-week treatment period was less than 10%. Try and remember that. And this was over 8 herds. And what they did comment on was that parity, particularly 5th plus lactations, was a real negative factor in the likelihood of improvement. And other studies since have shown that parity is improvement. There are various cow-related factors, particularly yield, but also environmental factors that may be related to the severity or indeed appearance of UCD, which include the size of cubicles and the type of bedding. And there's been some suggestion that sand bedding, particularly with its sort of abrasive qualities, may have an influence. And then the peer-reviewed Swedish study by Ekman and co-workers, who used a topical spray containing chelated copper and zinc, they started daily, and after 14 days, if they'd got to a score of 0 or 1, they stopped, but if they were still on score 3 or above, they continued for a further 14 days. Interestingly, the severe, i.e. score 3, 4, and 5 cases, most of those actually got worse in the first 2 weeks of the study, but then did seem to improve. But overall, they found no difference at all, comparing treated to untreated controls after 8 weeks, the treatment period being a maximum of 4 weeks. Although they did find a numerically but not statistically significant higher proportion of treated cows that went from severe to mild, or in a few cases no UCD, during those last 4 untreated weeks. And then there was a single study that's found in the literature, but it's not peer-reviewed, and it was only on one single farm, using the same product every other day for a period of 4 weeks. And they found that 18 out of 22 with mild UCD lesions experienced complete healing of the lesion. With a median time of 4 weeks, as I've said earlier, it's a long game, this, with a range of 1 to 11 weeks. So these mild UCD lesions described in this study are ones with no open wounds. The severe ones are with open wounds, and 10 out of 12 after 4 weeks showed improvement, but only 1 had completely healed. So our objective was to try and utilize a product that had been we've been doing some work with on the treatment of digital dermatitis, and extend it into seeing if it would have any effect on UCD lesions. And this is an adhesive gel barrier containing copper acetate and zinc chloride within a shellac matrix. Shellac is a form of clay and has properties on exposure to air that allows it to dry, and therefore creates a sort of a waterproof barrier to lesions when it's applied. This was spread over 2 farms in our practice in the southwest of England, and one university one university farm on the east of England. And I'll skip over that pretty quickly, but it was just to include it if anybody was interested in potential predisposing factors. All 3 of these herds were reasonably yielding herds, a good control of cell count, but the reason I really put it up is just to show that there's different milking systems, and more importantly, one was mattress cubicles, one was recycled manure solids, which potentially has more treponemes lasting longer in it, as we heard from the keynote speech this morning in another room, and then a sand bedding, as I've already said. There is an association previously in one study with a higher incidence in sand bedding herds. So animal inclusion, the scoring system was used as with the Swedish study, and animals with active UCD lesions of grades 2 to 5 were enrolled, and the herdsperson was asked not to treat it with anything else topically. There were no first lactation animals in this study, and all the cases enrolled had been of at least 4 weeks duration. And they were visited once a week by a vet and treated on that day, and at each visit assessed for malodor, wound exudate, lesion depth and signs of healing, and then cleaned in the case of farms B and C, i.e. the ones in the southwest of England, with a povidone iodine solution, and dried with a clean paper towel and photographed so that the lesion could be assessed by an independent blind veterinarian to give it a lesion score. And then the product was applied. And so there we go, that's a score 4 lesion, and that's what it looks like after application. It then dries, and you can accelerate it by flicking or spraying water. That's the earlier, more severe one, and that's what it looks after the product has been applied. And so all these 4 things were assessed each week and scored as better, the same, or worse. And as I've said, the photograph was then assessed for an overall lesion score, and also whether it was better, same, or worse by a blind vet, the same vet each time. We actually started this trial on farms B and C, and that gives you the number of animals enrolled, and we quickly became sort of aware that although things were progressing quite nicely, prolonged courses of treatment were required, and hence why Farm A, when that study started there, we managed to prolong the study for a period of 9 weeks. So as I said, weekly assessments, and overall each time it was scored as either +1 if it had got better, 0 if there was no change, and -1 if it was worse. And I should point out that a total of 10 enrolled animals on the herd in the east of England that were on the 9-week study were removed because at various times because they had fully healed. So that's what it looks like at day 0. For instance, that would have been a score 5, and that's what it looks like a week later, a lot of crusting, and so that would have been counted as a +1. And so overall, with all the weekly reassessments, so 3% had got worse, just over 20% had got no change, and over 3/4 had got better. And plotting it over time, you can see with the middle bar being the median and the interquarter ranges, that there was a steady improvement over time. Obviously, there's less dots after week 4 then subsequently week 5 because only less than 13 cows progressed beyond the 5-week treatment. So results: malodor, discharge, lesion depth, reepithelialization, appearance had all improved, whether assessed over the 4 weeks on all 3 farms or up to the 9 weeks on Farm A. And pictorially, that's what it looks like. So green is an improvement and red is still the presence. So malodor in the top left, discharge top right, deep as opposed to superficial wound on the bottom left, and reepithelialization on the bottom right. So that's for all the cows, N equals 26. Predominantly, a couple dropped out on the Farm A as time went on over the first 4 weeks. After 9 weeks, so we're actually only dealing with the Farm A at this period, predominantly beyond week 5. Again, the overall a good appearance of green, and the most pleasing thing really, and the most relevant thing to healing, was the presence of green from week 4 onwards. So overall there was a 62% reduction in malodor, 50% reduction in the discharge, 70% in the lesion depth, and 50% showing reepithelialization by week 4. And in terms of grade score, there was a nice progression of improvement, such that there were no score 5s by day 28. And some, as I said, had already healed fully. So looking at the results of Farm A alone, because of the need, we think, for prolonged application, 77% were fully healed. And I put it in red because in the previous 2 studies using zinc and copper, the percentage of animals with full recovery rates were 8.3% and 14.3% respectively. Though I need to point out that there were 2 differences in the materials and methods here. One, in those 2 studies, the initial treatment on day 0 was by a veterinarian, and thereafter it was by the farmer themselves, as opposed to our study, which was entirely by veterinarians. And the second one was the difference was they only cleaned the lesions each time with a clean paper towel, which is what we did with Farm C, the one that had the 9-week treatment, whereas Farm B and Farm C originally had povidone iodine solution in the cleaning process, which obviously may have had an influence, one would argue, on the healing nature of the wound potentially. So conclusions: once a week application of a liquid gel dressing containing copper, acetate, and zinc chloride promotes healing of severe UCD lesions in dairy cattle, with marked reductions in malodor, exudate, and the depth of the lesion, as well as increasing signs of reepithelialization. There were no adverse clinical events, seemed to be well tolerated, and we need to do now further studies using different frequencies of application. And closing thoughts: certainly as we as clinicians become more aware of this condition, I think our aim should be to try and screen herds more regularly, like one would for teat scoring and mobility scoring. Lesions take a long time to heal, and we need to bear that in mind when talking to our clients and managing their expectations. And certainly there is no doubt a genetic aspect to this, and indeed a recent paper coming out of Ghent under Geert Opsema has suggested that there is a big difference in the ability of affected animals to how the wounds respond compared to unaffected animals, namely sort of down-regulation of healing enzymes and molecules as opposed to upregulation of chemokines and cytokines that are pro-inflammatory. And indeed, it now looks like this condition in cattle has many similarities to leg venous ulceration in humans. I'd like to thank my colleagues at Synergy and their clients for their help, and particularly our colleagues over at Cambridge University, Patricia Alves-Samoes and Ian McCrone. Thank you for your patience, and if I may be cheeky, Mr. Chairman, I did promise I'd come back to that horrible granuloma. Won't take very long. So this is it at day 0. This had this liquid gel applied daily, every day. This is what it looked like after day 7. Bit of a change, drying up. And still product still there before reapplication. That's what it looked like at day 14. Day 18 become more like a sausage. And the cynics in the audience might just like to know that teat there with the black sort of pigmentation. Just to prove it's the same cow. By 8 weeks, that's what it looked like, and underneath, that's what it looked like. So, food for thought, when you're presented with one of those horrible UCD granulomatous, all is not lost. Thank you very much indeed for your attention. Thank you for your patience,
Thank you,
Mr.
Doctor.
Chairman.
So there is no more time for questions. We appreciate your participation. We appreciate the participation of all our speakers. Thank you, Doctor. It was been very enriching to listen to such interesting talks today and fulfilling the objective of the area of short communication. Likewise, we appreciate your attention and invite you to attend the forums this afternoon. Enjoy the lunch, enjoy the beach, of course, after the forums, and still enjoying Cancun, Mexico. Thank you very much.